अभी वो जस्ट पहुंचे जी, वो जो है दूसरे ड्राइवर को बुलाया मैंने, तो वो अभी पहुंचा। अच्छा मैडम, वो सेशन लोगों ने ज्वाइन कर लिया है, सेशन सब लोग आ गए।
Anand, 5 minutes are left. Who is the master of ceremony?
Madam Raksha Chauhan.
Okay. Okay, good morning. We have about 4 minutes, 4.5 minutes.
Most important person yet to join.
Yes.
Our Secretary General Pankaj.
Madam about to join. Just
Okay.
Madam about to join on the way, madam. Sorry. Darshan, namaskar.
Namaskar, kaise hain?
Good morning, and as I think that's you taking the very good coffee.
Yes, yes, but I cannot offer it virtually.
Virtually.
Better. Hello, good morning. Very good morning to the Vice Chancellors here.
Yeah, good morning, Dr. Rakesh Sharwal. Good morning.
Yes, sir. Thank you.
Yeah, nice of you.
Professor Thirusagan.
Yes, sir. How are you, Professor?
Yeah, I'm not a professor like you.
It's okay. It's okay. You are a doctor and you are more than a professor as well. Yeah, Johns Hopkins and Additional Secretary. Okay.
Is my slide visible, sir? Is my slide
very
visible?
very much, sir. Very much.
Yeah.
Okay, okay. So we will go through this. And we have stopped sharing this now. Wonderful.
Dr. Poonam, good morning. Good morning. You were there the entire sessions. I have noticed it shows your interest. You learn things as well. What are you there in the university? You have to unmute you. You have to unmute.
Sir, I'm not in a university. I head a non-government organization called the Population Foundation of India, which was set up 50 years ago by Mr. J.R.D. Tata.
Oh, that's great.
And we work very closely with the government on strengthening health and women's health, especially women's family planning population. And another area we work a lot is on adolescents and young people. And that's why I'm also particularly excited to be here with people who mold and work with young people.
அவரே எனக்கு ஒரு மெயில் போட்டிருக்காரு, எல்லா இடத்துலையும் கேப்டன் போட சொல்லியிருக்காரு. அதை மாத்திருக்கேன். நானே சொல்ல நினைச்சேன், இல்லை அதை அவரே மென்ஷன் பண்ணி போட்டிருக்காரு. நானும்
How nice to see you Kavita ji.
Hello, how are you? I was just wondering, I seem to be, sitting very quiet while everybody else is talking away. But good to see you, Dr. Poonam Mutreja.
Good to see you too. And I was just talking to our common friend a few minutes ago, Shiban Ganju.
Ah, how is he?
He's very well.
Touchwood, huh?
He's in Delhi now. He's moved to Delhi.
Oh, he's moved to Delhi.
Yes.
Okay.
So
where does he live?
Anand Niketan.
Acha. Okay.
No, not Anand Niketan. I'm sorry, I made a mistake. Anand Lok.
Anand.
But Anand hai.
Anand is. Okay. When did he move to Delhi?
About 3 years ago.
Okay.
And maybe even more. Kavita, where are you now?
Well, I finished my tenure as Vice Chancellor of South Asian University. And now I'm home. I've called it quits. I've done 48 years of work.
Wow.
It's about time to call it quits.
2 years more and golden.
I know.
There
Enough.
is no retirement for Vice Chancellor academicians. Professor.
No, there's no retirement. One keeps writing, and while I'm here with all of you, so
your service will be useful to other institutions, including AIU as well.
yes, that's what I'm saying. So I'm here with everybody, all the colleagues. So one keeps on reading, learning.
Yeah.
Your thoughts are the same as mine. I was just thinking I should get in once COVID is over. I should meet Kavita and see how we can take advantage of her.
Well, that's so sweet. Well, once COVID is over, I think you, I, and Shiban should all meet, and maybe we can go to India International Center and have lunch or something together.
Sure.
That would be nice.
Yeah.
So what is Shiban doing?
He's doing great work in the field of public health.
Okay.
So partner in UP in the most backward areas. We're working on bringing down maternal mortality, family planning. Then he does a lot of work on testing Ayurvedic medicines. And
oh, lovely. That was his interest at one time. Yeah.
Yeah. So he's got 100 researchers, and mainly, young women who are from small towns who have done biology.
Anand, we can start. It's already 10 o'clock.
Yes, sir. Raksha ma'am?
Yes, sir.
Rita, my number is the same. If you send me your new number, we'll connect out.
I don't have your number, unfortunately.
I'll send it to you.
Do you have mine?
It's
the same.
Okay, I'll send you. I have yours.
Yes, Raksha madam, start करें.
Yes, sir. Good morning, honorable dignitaries. In the second day of AIU Central Zone Vice Chancellor Meet 21-22 on realizing sustainable development goals through higher education institutions for securing basic essentials of well-being, organized by AIU and hosted by SVVV. I, Dr. Raksha Chauhan, welcomes Dr. G. Tiruvasagam, President AIU and Vice Chancellor MH University Chennai, Dr. Upinder Dhar, Honorable Vice Chancellor SVVV Indore, Dr. Pankaj Mittal, Secretary General AIU, Dr. Kavita Sharma, former President South Asian University, New Delhi, Professor Ajay Kumar Singh, Vice Chancellor SSU, and all the invited Vice Chancellors and Directors in Technical Session 3. The basic theme for this technical session is contribution of higher education institutions in ensuring healthy lives and well-being. The goal of the session is the goal seeks to ensure health and well-being everyone at all stages, including access to safe, affordable, and effective care. Some of the major points for the discussion of this session are how HEI can contribute to promote health lives and well-being. What is the specific role of health universities, technical universities, and various other HEIs achieve this goal and how the new and traditional health system can contribute to achieve these goals. It's my indeed pleasure and honor for me to introduce Chairperson of the session, Dr. Kavita Sharma, former President. Dr. Kavita Sharma has been the founder President of Parents Forum for Meaningful Education, and she has been active contributor to the cause of higher education through her teaching publication and associated institutions. She is associated with many professional organizations, including English Association, Indian Association of Canadian Study, Indian Law Institute, and Indian History Congress. She has been published several books, including Internationalization of Education, 60 Years of University Grant Commission, Hindu College, to name a few. Her international and national research publications cover wide range of topics like higher education, language, immigration and identity, culture and women, etc. She was conferred the Indira Gandhi Sadbhavna Award by the National Integration and Economic Council in 2005. A warm welcome to you, Madam.
Thank you very much. Thank you very much for this kind introduction. Raksha, I just want to intervene. You have brought many new dimensions of Madam to the fore, but basically she has been the former president of South Asian University and former principal of prestigious Hindu College of Delhi University. So I welcome you, ma'am, on behalf of AI. Thank you, Ramaji. Thank you.
Okay, moving ahead, it's my pleasure and honor for me to introduce speakers of the session. First speaker is Dr. Rakesh Sarwal, Additional Secretary, Health and Family Welfare, Vertical Niti Aayog. Dr. Rakesh Sarwal has served in senior public health, public policy, planning and management over 3 decades in Government of India. Dr. Rakesh Sarwal combines an academic rigor inside of what works to analyze and develop solutions to society's problems. Dr. Sarwal believes in working through collaboration and team building. We welcome you, sir.
Thank you, Professor Raksha Chauhan. Thank you very much.
Thanks, sir. Moving ahead, we have another speaker, Dr. Vishal Chauhan with us. Sir is Joint Secretary, Ministry of Health and Family Welfare, Government of India. Dr. Vishal completed Master of Science in Public Policy and Management from King's College, London, and sir is a 1998 batch IS officer of Sikkim cadre with strong administrative professional skills with a demonstrated history of working in the public policy area. Dr. Vishal is skilled in energy sector, project management, banking, public health, cross-functional team leadership, public policy and management. A warm welcome to you, sir.
Thank you very much. I am not Dr. Vishal, I am Engineer Vishal. Thank you very much.
Next speaker of the session is Dr. Kakoli Ghosh ma'am. She is Chief Technical Advisor, Sustainable Rural Agriculture Development Program, FAO, Riyadh, Saudi Arabia. Madam is the agriculture specialist from Food and Agriculture Organization of the United Nations and specializes in sustainable agriculture system, agrobiodiversity and partnership development. She served as the first coordinator of FAO partnership with academia and research institution and then moved to the global management team for a strategic program on sustainable food and agriculture. Currently, she is based in Riyadh as the first Chief Technical Advisor, Sustainable Rural Agriculture Development Program, where FAO is providing technical and advisory assistance to the government of Saudi Arabia for advancement of agriculture, natural resource management, value addition, and rural development. A heartiest welcome to you, ma'am. Our next speaker is Dr. Poonam Mutreja ma'am, Executive Director, Population Foundation of India. Madam has more than 30 years of experience in the socio-development sector. Dr. Mutreja has expertise in women's health, reproductive and rural livelihoods. She serves on the governing council of several non-government organizations and is a regular commentator in India and globally for television and the print media. As an innovator in the field of development, she has founded organizations in the area of social justice, craft, and programs on leadership, especially in the field of women's health, and been a member of the family planning group. A heartiest welcome to you, madam. Next speaker of the session is Dr. Indrani Gupta, Director, Institute of Economic Growth, New Delhi. Dr. Indrani Gupta received her PhD in economics from the University of Maryland, USA. Her work experience has been varied, including teaching and academic institutes, the World Bank, and the Government of India, where she worked as a career economist. Her area of interest covered a wide range of topics and include demand for health and healthcare, health insurance and financing, poverty and health, to name a few. A warm welcome to you, madam. Moving ahead, it's a pleasure for me to invite Chairperson of the session, Dr. Kavita Sharma, ma'am, to give opening remarks to the session. Over to you, ma'am.
Thank you, Dr. Raksha. And thank you for having me here on this session with all of you. It's a pleasure to be here in such a distinguished group of academics and leaders in their field, especially in university leadership, which is so vital to our country. We have with us 6 speakers today, so I assume we will take 10 to 15 minutes for every speaker, but to have my say for 3-4 minutes. SDGs, as we know, followed the Millennium Development Goals and will continue up to 2030. The approach in the two was different. The SDGs, unlike the MDGs, are from ground upwards. And there was widespread consultation before they were formulated. So now we have 17 SDGs with 169 targets. So that's very elaborate, and with 232 indicators. Now, when we talk of role of higher education institution in the 3rd SDG, which is about health and well-being, we have to remember, and all of us who are part of the university system, that a university is a part of the community. It cannot remain isolated in an ivory tower. And therefore, it has certain special things that only a university can do. It can do capacity building. It can do research. There is teaching. It can formulate evaluation metrics better than many others, and it can influence policy. So there is a range of topics which I think the universities can help with. One is maternal and health and infant mortality. Especially in this time of epidemic, it becomes even more vital for universities to play their role. Then awareness about road injuries, deaths, creating universal access to health coverage. In our country, the health coverage is abysmally low. Helping with awareness and programs with reproductive health care, communicable and non-communicable diseases. And for the first time, 2 things have been introduced in the National Policy of Education. One is mental health, which was long neglected. And I'm very, very happy that, anyone, if you go to any therapist, they will tell you that their largest practice is with adolescents and young adults. So mental health issues. And the other thing that have been incorporated is indigenous systems. So we have things like indigenous knowledge of Ayurveda, of Siddha medicine, of homeopathy, and other such indigenous knowledge. We have to remember, with our health coverage is so poor, that a lot of population depends on indigenous knowledge systems for their health and well-being. Now, the universities, the role of the universities has to begin at home. We have to make sure that our health of our students is protected, of our staff is protected. I still remember in my university, I had a student from Bangladesh and he had a renal failure and he needed a kidney transplant. Now, obviously, and he came from a family which just couldn't afford it. They didn't even have passports. They had sold their land to send this boy for education in Delhi. So we sent out a sort of appeal to all our staff and students and to alumni, whatever little there are in a young university. And you will be surprised to know that within 2 to 3 days, we had collected 18 lakhs of rupees required for his kidney transplant. And that was done. So it is for the universities to protect the health of the students and to staff, and also create very conducive mental health working environment and physical health working environment. Also protect the environment around it. Then through teaching and research, promotion, health promotion, and promote the health of community, which means it has to conduct outreach programs. For this, it must be emphasized upon students, I think, that an individual is very much a part of the community and must promote the well-being of the community if the individual wants his own well-being. And therefore, students through various, and this has to be integrated in all the courses we teach, an understanding of what is sustainable health. We must also, I think, undertake training programs and create a partnership between the individuals of the university and the community, so that there is a healthy social development, at least of well-being around us. The partnership can begin, it always has to begin small, from the local, national, to global communities. And we can advocate public policy through our teaching and research, especially research and evaluation metrics. We can put correctives there. We have to understand, and our students have to understand, that human and personal development go hand in hand with economic development. Because what happens is that most of our students, even teachers, all of us get focused on economic development. We forget about the personal development. And therefore, we need to promote things like hygiene, sanitation in the community, hygiene education for the community in terms they understand. I keep saying that research cannot be just an ivory tower thing. There is room for democratic spaces by which we disseminate what we research to the community in a language that they understand and which they can comprehend. Again, issues of immunization, vaccination. Now, today, the great need is to somehow promote vaccination among people. Immunization, vaccination, birth control. But how do we do all this? It's easy to say, do it. How do we do it? Well, undertake some projects. But for that, it has to be grounded. First, we need to know where are we working? What will be the dimensions of the space in which we are working? What is the locality? Is it a city? Is it a locality? What is it? Know the demography of that place. Again, what are the built up spaces here? What are the vacant spaces here? Because the strategies would be different. What is the organizational and administrative structure? How can we approach the organizational and administrative structure? What are the prevailing medical issues? There's no point in talking about tuberculosis in an area where the major killer is HIV, AIDS, or heart disease or something like that. So you have to choose your targets. Develop a relationship with the community, because unless we do that, our voice will not have the authority. And therefore, to develop an authoritative voice, we have to develop a relationship with the community. And remember that health is not absence of disease. In our system, when we say swast means not absence of disease, but to be situated within yourself. That means It includes mental health and a healthy mind, a healthy body, a healthy emotional quotient that we need to have. And finally, the aims have to be clearly specified. What are the long-term aims? What are the short-term deliverables? What will be the, unless we have short-term deliverables, nobody will believe our long-term aims. What is the methodology, the clear idea of methodology that we are going to use and not muddle through? What is the time required for expected outcomes? What will be the evaluation matrix and the impact formulation? And then funding. All of this requires money. So the funding has to be built into the university budgets. So these are some of my prelim remarks. Now, may I request Dr. Rakesh Sabharwal to share his thoughts with us.
Well, thank you very much. I am Sarwal, just to correct my last name.
Oh, sorry, Rakesh Sarwal. I'm so sorry.
So I am really honored to be here this morning in this conference of the Central Zone Vice Chancellors. I think it's a very positive trend where when we are about to launch the new education policy, which calls for interdisciplinary and cross-disciplinary learning, what better way to do it than to open up the Vice Chancellor, the heads of the educational institutions, for inputs from practitioners and experts in fields which are of relevance to the university curriculum and system. So I think it's a very positive move, and I'm really humbled by being invited to this conference. Also humbled by the presence of very esteemed health experts here who bring in their own knowledge. I think it's a very complete group which has been invited over here today. So very briefly, I will just list out the broad domain and the systems approach to health, and then go down to what is it that universities can bring in terms of teaching, learning, research, and practice within the colleges as well as within the campuses. Now, as has been mentioned, health is not just the absence of disease. It's a very loaded word. It's a very holistic word, as the WHO themselves define: a state of complete physical, mental, social well-being, and they emphasize not merely the absence of disease or infirmity. So in this diagram, which is given over here, is the body, mind, and the spirit embedded in the family and the community, and our personal behaviors, biology, psychosocial environment, and physical environment, our work, our self-care systems, all of them really influence how we are, how healthy we are. So it's critically important to understand that health is not a commodity. It is not something that we can buy off the shelf in a hospital or order online. It is something that we do every moment. It is something that we live every day. It is what we think, what we do, what we eat, how we behave, and how we interact in our immediate surrounding. These two immediate benefits of health. When it falls, the 90% of the time, this is how we are managing our health ourselves as individuals and community members. When it fails, then it becomes a disease and we get into the medical system. So the health and the medical system, this understanding is critically important. And that's why the role of universities, the role of colleges in making people understand that health is something which is produced in families, in our lifestyles, in the way we behave. And it is totally different from the medical component, which is getting us back on trails when we are off the track, when we fall into the trap of disease. So that is one basic thing that we all, I'm sure we all know, but I just wanted to emphasize this. Now, holistic wellness, beyond, there is an element of disease, there is an element of health, and beyond that is wellness, the concept of wellness, the highest of these concepts. So wellness, again, is physical, spiritual, occupational, social, environmental, intellectual, and emotional. So it's a multidimensional component. And I believe that universities and colleges can really be places of practice, of demonstration, and experiment in higher levels of wellness, both for the students and the teachers. So they offer tremendous opportunities for practice of these ideals of wellness. Now, in the health systems, as the definition tells us, there are two main dimensions. One is the clinical care, where one-to-one we deal with the patient. And second is public health, where we deal with community as a unit and the health systems approach. Now, this is what the 6 building blocks of the health system as defined globally and accepted. It's about service delivery. What is the clinical part we all know of, which requires information, whether it is electronic health records or population level information and research. It's about medical products and technologies, the workforce, the man behind or the women behind the machine, the financing, which is critically important. And above all, it's the leadership part, the thread in the necklace. It's about the connecting the dots, bringing everyone together into a coherent delivery of the health system. So these blocks all make up an efficient health system. And different countries show different, and different states also in our country show different levels of competence and efficiency in achieving this health system goals. So they all add up to ultimate outcomes of improved delivery, responsiveness to the health system, as we recently saw, new challenges, infectious disease challenges, other challenges are coming up in our system. How responsive are we to them, and how quickly we can adopt our system to provide preventive, promotive, and rehabilitative services. Financial risk protection, extremely important. Professor Indrani is here, an expert on this, national global expert. Health expenditure, particularly curative health expenditure, is a huge cause of impoverishment. And one of the goals, and SDG goal as well, universal healthcare is defined in terms of providing services which citizens need at a cost that they can afford. So that is one of the goals. And of course, efficiency, overall goal remains the efficiency of the health system. So these are the broad objectives of the health system. Now, inbuilt in the health system is a curative as well as a public health system. And these are globally recognized 10 essential public health functions. These are core governance performance functions, which are necessary for the entire system to perform well. Now, broadly, they are assessment, assurance, and quality performance. So if you go one by one, it's about assessing and monitoring the population health. It's about investigating, diagnosing, and addressing health hazards, which we saw during the recent COVID and the ongoing COVID pandemic. It's fundamental to generate information, communicating effectively to inform and educate our citizenry, because health is a social issue. It's not individual matter. We are all connected, both as a society, as a nation, even now as a globe, environmentally, physically, we all influence each other's health. So communicating to everyone the risks and the dangers and how we can prevent it, how we can maintain our and society's health is critically important. Strengthening, supporting, and mobilizing communities and partnerships. Again, getting everyone along, creating champions and implementing policies, plans, and laws is generating local leaders, because communities own the health of their area. And there are very good examples globally where health assemblies do take charge of the local service delivery, and they define their agenda and see what way they can be healthy instead of being dictated from some central authority. Using legal and regulatory actions in a way which empowers the citizenry and doesn't force them without adequately informing and taking them along is also important. Kerala is an excellent example where they have a Public Health Act, which has been recently amended, was very successful in getting the community participation for containing COVID. Equity is at the heart of all the developmental actions that we do, and particularly in health sector, because when it's curative, then the cost can be very high. And it's also embodied in the Universal Healthcare Declaration. Building a diverse, skilled workforce, again, a health system element, improve and innovate through evaluation, research, and quality improvement. Again, the learning part, quick learning part, learning health systems, and building and maintain a strong organizational infrastructure for public health. This particularly, the last part is extremely important, because internal studies we have done and assessed that countries which have a clearly defined authority with accountability for maintaining public health have performed exceptionally well at lower cost than other countries which don't have such systems. So an effective public health agency is extremely important for the entire system and for its efficiency. India faces multiple challenges. I'm sure we all know of it, but this is just to put it together. It's about access, quality, cost, double burden of disease, our health systems being weak for all the reasons that we talked about, and a growing private sector without adequate regulation in a way to protect the citizen from both quality as well as cost issues are our current challenges. Now, quickly, we are talking of the population segment in our universities and colleges, which is young. So 18 to 35 is the general age group that we consider. But the disability adjusted life years data is available for this age group, which is 15 to 45. And that's why I'm showing this slide. Just to go through, how has the burden of disease changed in the last 30 years? And this is very revealing. We are developing, but we have still to leave the hangover of our previous burden of diseases. So we see that while respiratory infections and TB have gone from number 1 to number 8, cardiovascular diseases have become the number 1 killer. They are the number 1 disability causing diseases. Recently, our previous speaker talked about mental illnesses. They were 6th, now they are number 2. They become a major problem of DADI, loss of well-being and productive health. Other non-communicable diseases have again become important. Musculoskeletal disorders have become important. Diabetes, hypertension, these conditions have also gained in significance. What has fallen off is respiratory diseases, enteric infections, which is gastrointestinal infections, maternal and neonatal conditions. There's been a considerable success in our country. Intensive action has led to a lowering of the morbidity and the burden due to these conditions, which have shifted down the ranks. The next slide talks about deaths. Deaths per 1 lakh population, the change during this 30-year time frame. Here again, similarly, cardiovascular diseases, self-harm and violence have become very prominent of late. And there are states in the country which have among the highest rates of suicide globally. So mental illness, suicide, they're all continuum of a disease pattern we need to be conscious about. And this is where our universities have a very important role, because in the best of the universities and the colleges and the countries, we have had considerable number of cases of suicide and self-harm. Now, how can we inculcate the spirit of being healthy, being well, and being mentally also healthy among our students and among our residents of those campuses is extremely important, because a healthy body resides in a healthy mind, and we need to huddle together. We need to provide support to each other whenever there are challenges, many of which do occur during these formative years in life. Neoplasms, the cancers have risen. The cancers among the younger age group have risen from 8th, they have risen to number 3rd. And again, the other infectious diseases remain. So knowing the challenges to health in this age group can really help us ensure an ecosystem on the campus in which each one of our students is healthy, they are aware, and they create an environment where they can build positivity around themselves. This is again a chart of the country giving burden of DALI, disability adjusted life years. We see there is a considerable variation across the country with varying levels of disease burden in different states. And the universities and the colleges need to be aware of the unique burdens in their area and the unique challenges among the students which are there in those colleges, so that they can be appropriately addressed. And similarly, this is a chart for the deaths for different countries. Again, largely the picture being the same. Non-communicable diseases are larger in the southern states and the communicable challenges in the northern ones, with a lot of intermix of the two. There has been, I mentioned about considerable success in reproductive and child health. The child mortality levels have fallen considerably. And neonatal mortality, infant mortality, unidentified mortality, they have been a great success story. And this one indicator is considered as an important index of the performance of our health system. So fantastic progress in this area, thanks to the leadership that we have been getting. Similarly, the progress in terms of nutrition has not that been dramatic. In fact, anemia levels have risen, and even the wasting levels have remained persistently high. So this nutrition is a challenge that we need to make our students aware of, because the solution lies within our hands. It's about how we eat, what exercise we do, what toxins or what risks we avoid ourselves from. So this awareness is critically important. And the pressure of advertising, commercialization is too strong for us to go for both the risks as well as not to avoid the factors which are unhealthy. High salt, sugar, fat, these in diet are major risk factors. So I think this is also a critical element that we need to bring on board in our campuses. This is a slide. This is beautiful work that Geographic Insight Lab of Professor Subramaniam at Harvard University has done, where Neeti is a collaborator, where for the assembly constituencies, the districts, the parliamentary constituencies, as well as the villages, we have mapped the burden of various risks as well as conditions in the country. And this is one example of stunting. We can see that we are really a very diverse country. And while there are pockets where the levels of stunting are very low, there are similar pockets where it's very high. And depending upon where we are, where the universities, where the colleges is, we need to utilize our expertise as well as the knowledge of what works in order to make a difference in our immediate environment. Similarly, underweight. This graph shows that underweight and stunting are not really synonymous. And underweight is an acute phenomenon. It's about immediate short-term lack of calories. And there are huge pockets in even very developed states where it's a rampant problem, where the levels are very high. And I'm sure our universities, NSS, and Unnat Bharat Abhiyan, a number of campaigns that we run in our universities can really make a difference, first on campus and then surroundings. You would be very surprised to get the hemoglobin level of students in a university done. And the range that it presents would really be an opener, and also open possibilities of what can be done on the campus to improve the health status of the children over there. Now over to financing. Of course, Professor Indrani is an expert in this, but I go through one or two slides on this, that to show that even at our current levels of 3.5% of GDP we are spending on health, 1.3% of is in the government sector, and 5% of the budget is into the health in the central government. A large part of our health spending is borne by the households, the green one. The second one, the second big contributors are the states, and thirdly only does the central government come in. In terms of numbers, on an average, the country is spending 3,805 per capita, and the households are contributing a large part of this. Similarly, in terms of per capita government health expenditure, it is at a very low level of 1753, which is among the lowest in the world. And the households are spending something like 2,000 out of pocket, mainly contributed at the point of care, which is a regressive mode of financing. And that's why our health efficiencies in terms of what we are spending and the outcomes that we receive are lower than that of Bangladesh, our neighbor, who was behind us till recently. What can the universities do finally? I think the summary is, the basic point is making our students aware of what is health, what is wellness, and what is disease, how they can be healthy themselves, how they can be healthy as a community, and how they can contribute to a society, to a nation, by being a responsible citizen, because health is essentially not just medical, not just nutritional. It is a social good. It's about thinking, and it's about acting, and it's about behaving. So thank you very much for your attention.
Thank you very much, Dr. Sarwar. You know, we have to, I think, also to add two lines to what you said. Understand that ill health, as you pointed out, is, you know, the burden is borne by families, which leads to their impoverishment and their lack of opportunities. So it is in our enlightened self-interest And this has an impact on the whole of society. Plus, it becomes a very inefficient society. And then the other problem on college campuses is alcoholism and substance abuse. That needs to be addressed, with a lot of vigor, because it is leading to a lot of wasted lives and delinquent behavior, which is very which is very injurious to individual families and society as a whole. Now, with these few words, may I request Dr. Vishal Chauhan to share his thoughts with us.
Thank you very much, Professor Kavita Sharma, madam, and my co-panelist, Dr. Rakesh Sarwal, Dr. Nitin, Dr. Kakuli Ghosh, Dr. Poonam Mutreja, and Dr. Indra. So I'm very grateful for Association for Indian Universities who have called me for this webinar. And I'll be talking about the contribution of higher education institutions in the for achieving the Sustainable Development Goals. So just a quick recap, though Madam Kavita Sharma has already told that Sustainable Development Goals were as a continuation of the Millennium Development Goal, and they started in 2015. So target is to achieve these goals by 2030. And it is approved by the United Nations General Assembly. And altogether, there are total 17 Sustainable Development Goals are there. And they all are interlinked and related to each other. Like poverty has an impact on the health, hunger has an impact on the health, education has an impact over health, and so has the gender equality. So all these Sustainable Development Goals are interlinked, and I'll be focusing myself only on the Sustainable Goal number 3, that is the good health and the well-being. So, and I will be also discussing about what are the various, government new thinking as far as the health is concerned, what are the new initiatives taken by the government, and what is the role universities can play or higher education institutions can play for achieving the Sustainable Development Goal 3. So I'll be giving a larger picture about the health sector scenario. National Health Policy 2017 says that health spending, government health spending should be 2.5% of the national GDP. Presently, it is increasing. In 2013-14, government was spending 1.15%. Now, government is spending 1.35%. This is from the National Health Account prepared annually by the NHSRC, National Health System Resource Center. It's an arm of the Health Ministry. This is prior to PM announcement of the PMJAY and National Digital Health Mission and PM Abhim. There are so many new schemes have come. So once we'll have the National Health Account for 18-19, 19-20 or 2021, we will see this figure is going to increase. The National Health Policy also says that 2/3 of the expenditure has to be in the primary healthcare sector. And it is very important because many a times health means spending more on the education, more on the tertiary care, more purchasing higher equipments or setting up more tertiary care center. But 90% of the health issues can be resolved at the grassroots level, at the primary health center level. So policy envisages that at least 2/3 has to be in the primary health sector. Presently, it is 54.7%. And as we can see that as the expenditure by the government in the health sector is increasing, it was from 28 as Sarwal sir was also saying, lot of health is in the private sector. But we can see that now from 28.6% in the 4 years, it has reached to 40.8%. So government health expenditure as a total health expenditure is increasing. And also what is very heartening to know is that out-of-pocket expenditure made by the public is decreasing in 13-14 it was 64.2%, and now there is a drastic increase in the last national health account, which is available for 17-18. It is now 48.8%. So once we take into account the newer schemes launched by the government in the recent 2-3 years, the out-of-pocket expenditure of the poor of the marginalized section will reduce. So I think we are going in the right direction, but lot need to be done before we achieve the desired targets. Another big picture I want to give you is the reforms in the medical education or medical education sector or in the health sector. The number of we have seen that National Medical Council has been created. The number of medical colleges have increased from 387 in 13-14 to 596. And you will see the increase is more in the government medical colleges as compared to the private medical colleges. So we can see there is a 54% increase as far as the number of medical colleges are concerned. If you see the UG seats, there is an increase of 72% as compared to the 13-14 and 21-22. And if you see the PG seat, there is a 78% increase in the last 7 years. So we are trying to achieve almost double what we could achieve in so many years. In the last 7-8 years, we are trying to achieve the double. So the WHO norms that we should have 1 doctor per 1,000 population and all these things, very surely if we move in this direction, we are going to improve. So I understand that here we have a representative from the medical universities and medical institutions. They are leading this movement from the front. There are technological universities may be there, and there are other social or art sector universities are there. So everybody has a role to play as far as the SDGs are concerned. So these are two things I wanted to convey. Then what government has done is that under the series of Aishman Bharat, the 4 schemes have been launched. One is, this is primarily related to the primary health sector. Earlier, if you see a small triangle where the existing services are RMN, CH, A+. So it is basically reproductive child health care, adolescent health care, and all these things. Only this was available in the primary health sector. And as sir was saying that the disease burden is increasing from communicable to the non-communicable diseases. So what we have added in the primary health sector is that unmet need was non-communicable diseases. So village-wise, the screening is going on for the diabetes, hypertension, 3 common type of cancer, that is the oral cancer, cervical cancer, and the breast cancer. And then there is a referral or gatekeeping arrangement, and then the secondary and the tertiary care is strengthened. And how secondary and tertiary care is strengthened is when we have a second scheme of Aishman Bharat. This is the first scheme of the Aishman Bharat Health and Wellness Center. The second scheme of Aishman Bharat is the PMJY, where the private and government hospitals are covered, and they are the treatment is provided to the families free of cost. Some 50 crore people are enrolled. 10 crore families are enrolled in the scheme. So this is Pradhan Mantri Aishman Bharat Jan Arogya Yojana scheme. It was launched in 23rd September 2018. So these are, but important point to see in this slide is that 2.3 crore authorized hospital admissions have been there, and 27,000 crore rupees of the poor has been saved by this scheme. So this is the second scheme of the PMJY, and I am very sure that the way the Niti Aayog and Dr. Sarwal and his team under the leadership of member Niti Aayog is pitching for the missing middle, because we have a higher income group, and then we have those who are covered here, but there is a missing middle income group, which they also want that they should be provide affordable healthcare services, and they should not be left only to be fetched by the private sector. So there is a thinking going on about the missing middle also. So Third scheme, which is recently launched on 25th of October, is the Aishma Bharat Health Infrastructure Mission. This is the biggest health infrastructure scheme in the last many years. 64,000 crore is the resource envelope, and it is going to be implemented in the for 5 years. And it is the largest pan-India scheme as far as the health infrastructure is concerned. So this scheme talks about increasing investment in the public health, the world-class infrastructure to be created. All the districts will be provided with have to be made self-reliant in terms of surveillance, diagnostic, treatment, and comprehensive capacity will be developed. So from the sub-health center to the critical care blocks in the districts, the integrated public health labs, so all these infrastructures are coming under this scheme, both in the states as well as in the center sectors. This scheme thinks of the saturation approach, where the all villages are to be covered, or blocks are to be covered, or districts are to be covered. So villages will have the health and wellness centers, block will have the block public health lab. Every block in the country, some 6,500 blocks are there. Every district will have a critical care block, and every district will have an integrated public health lab. So this kind of infrastructure is coming in the Aishman Bharat, which is the third scheme of health infrastructure mission. And fourth will be the Aishman Bharat National Digital Health Mission, where every citizen is going to have a digital health ID. Now, and one can carry his own records as far as the medical health records are concerned in a digitized form in a DigiLocker. Now, what happens is that somebody gets referred from one hospital to another hospital. The entire testing, entire diagnostic is done again and again. So a person can carry his health record in a mobile phone, will allow his health record to be shared to the treating doctor or the hospital. And also you have a choice, whether you have 10 reports you want to show to the 2 reports, you can do that. So these are the 4 schemes, Aishman Bharat series, which are launched by the government. So as I said, there are 13 targets as well as the sustainable development goals are there. 3 targets are related to maternal mortality, and newborn care, death of the newborn and the children, the neonatal mortality, and universal access to sexual and reproductive health. So 3 targets are related to this. And here we have, at least in 2, we have achieved the success, and we have achieved the SDG goals for the 2 targets. Rest we are in the process of achieving it. So what universities have a role to play in this, that we have population research centers in various universities and with various institutions. These population research centers are controlled or we can say owned or managed by the universities, but they have an interaction with us. So they provide critical research input as far as the national health program is concerned, and they are part of the common review mission, which is done under the National Health Mission, and also they are part of they provide input for the annual NPCC meeting which they have with the states. So we are also working how to more add population research centers and how we can improve their utility, and we can use them more. So also what we have suggested is that every medical college to adopt at least 10 Aishman Bharat Health and Wellness Centers. So it is going to be very beneficial for the students as well as for the faculty, and they will have a fair idea. So I am sure that in these areas, if the universities will work, especially the medical universities and other universities, it will be very beneficial in achieving the national goals. Then the 2 targets are related to communicable diseases and the non-communicable diseases. So as far as the non-communicable diseases are concerned, it is very important to know for everybody that non-communicable diseases account for 63% of the total death in the country. As Sarwal Sir was saying, that that the disease burden has shifted from non-communicable diseases to communicable diseases. And they are led by cardiovascular diseases, and then of course the cancers and diabetes and so on and so forth. And also we have to important that there are important risk factor associated with these non-communicable diseases. They are like what Madam Kavita was also saying, that current tobacco use, current alcohol use, less intake of fruits, or inefficient physical activities. And this we have to understand that, and the percentage is very, very high, 32% for the tobacco, 15% for the alcohol, and lack of physical activities is like 41%. So universities of the future have to be prepared to bring this lifestyle change in not only the teaching faculty, students, or in the community, as Madam was saying. So this is where that universities are going to play a very important role. So again, this is the same thing depicted in a pictorial form. So what are we doing in our universities to improve the healthy, to include the healthy lifestyle? Whether we are doing the yoga session or the physical activities, are we providing enough avenues for the students for these activities? Are our universities are having junk food outlets, or we are having healthy food outlets? So these are the things universities and have to think, or higher educations have to think to achieve this. So again, the same thing, and about tobacco, I will come later on. So basically, these are the initial years, and tobacco, as we know that if you start if you can avoid in the college years, you can avoid for life. So similarly, cigarettes also, or alcohol also, if you don't take in the college times, then the possibility is that you may not start at all in your life. So these are the things where universities have to be really proactive in achieving all these things. Mental health, Madam said, is a very important thing. And 25 years back, when we were in the universities, we had no idea about the mental health. We could see somebody is lagging behind in the studies. We could see somebody not participating in the discussion. We could see somebody, but we had no idea that something called mental health is there, or the person needs help. So NIMANS is now having so many courses on the digital. They have a digital academy, and they have running so many courses on the mental health. They have a national mental health helpline is also there, where students can access, faculty can access, researchers can access, because people face problem. They're in a large group, they face for problem. They're away from family, they face problem. So the mental health helpline has to be used, and it is in 13 languages. Now, very important course that NIMANS is running, a mental health gatekeeper. Mental health gatekeeper can be a professor also, can be a student also, can be anybody, counselor can be there. The mental health gatekeeper has that skill to identify that so and so is going in depression, or so and so student or person is facing a tough time, feeling loneliness. So that mental health gatekeeping course is, these skills are imparted by NIMANS, can be done online, and NIMANS Bangalore. And if these are done, then otherwise in our time, we only used to come to know so and so committed suicide. We had no inclination or idea of whether so and so is going to commit suicide. But now there are techniques, there are ways to, that awareness has to be there in everybody. If somebody is slow in participation or something, then there is a problem, and we have to understand those problems. So as I said, substance, Madam was also saying substance abuse, narcotic, drugs use, alcohol, and injuries and road traffic. So of course the universities have to play a very important role. There is a national toll-free drug de-addiction helpline is there. Then universities have to impart life skills, the first aid training. So we don't know if somebody is having a cardiac arrest. We really don't know what to do. Nobody knows actually. Somebody is entered into the swimming pool. None of his colleague knows how to give him the first aid. So these are the life skills have to be imparted to the students. And of course, the technical universities have to faces more on the road designs and all these things. India has banned electronic nicotine delivery system. Use of tobacco is there. No shop is permitted within 100 yards of the educational institutions. And all these things are there. There is a tobacco quit line is also there, which is nationally run. So then another targets are like universal health coverage, financial risk protection, and all these things. So I can also say that universities are best places for the for the electrical vehicles, the encourage use of cycling and all these things. I will not spend much time on this. Of course, the medical universities and also the technological universities have a major role as far as the health sector is concerned. Especially now, yesterday we were having meeting with the Tamil Nadu government. The MD NHM, Mr. Darej, was telling me that, sir, I have got 2 lakhs HRCT scans with me. I will use the artificial intelligence technology, and from there I will come to know who are TB patients. So those HRCT have already been done, in the records are there. So we have to use the AI, how we can use them. So even I am told that IIT Kanpur also wants to set up a medical college. So because now the interlinking is so great between the medical universities and the technical universities, and technology is going to play a very important role. So another 2 targets are like substantial increase in the health financing and training and development. So in the country, there is a shortage of manpower as far as the nurses are concerned. There are regional disparities. The paramedicals are concerned. So universities have to look where are the gaps, and they have to start more courses. And also there is a potential that we can export the manpower also once our manpower is there. So my last slide is, their research says that forget about directly linking to the sustainable development goal on health, but higher education level is a reliable signal for risk of incidences of reducing the NCDs in the later life. Health education is proven to contribute towards appropriate behavior towards the infectious diseases. Researchers have found that early drug and alcohol use is associated with the lower education. So education has an important role. And seatbelt uses safety, basically self-safety is very important, and it is linked to the education. Higher education, men and women have shown increased knowledge and uses of a contraceptive, and higher education level is associated with higher income and better health-seeking behavior and the health insurances. And quality education opportunities are imperative to develop capacity and to develop adequate health workforce. So I think higher education institutions have a very important role as far as achieving the sustainable development goals are there. Thank you very much.
Thank you very much, Dr. Chauhan, for this extremely enlightening talk of yours, telling us of all that has been done. May I request that, all this gets lost in the din of your talk channels, that you need to have an awareness campaign of what all is available and what all is being done, because I don't think, I was listening with rapt attention to what you were saying. I don't think I knew most of what you were talking about, all these various schemes and whatever is also already available. Now, so you need to run, awareness campaigns in schools, colleges, universities, to at least make people aware of what is available. Now, as far as students are concerned, the National Policy of Education also has a very important component of mentoring for the first time, as part of a teacher's duties. But for that, the teachers have to be trained. Today, the issues are so complex that, the teachers themselves are not, don't have the capacity. They can do maybe career counseling, but to do actually mentoring of a person, you need a little more training for that. And even the social sciences have a lot of role to play in health, because there are a lot of cultural barriers to accepting certain health practices. And scientists, medical personnel, health personnel have to be aware of what those linguistic, cultural, mythological barriers are there to accepting the health services. So here again, you need to have that, and then physical education. You know, in most of our universities, my colleagues will bear me out, NSS, NCC, physical education are supposed to be compulsory part of the curriculum. This is more breached than actually followed. At least I know in Delhi University, we were supposed to have it as compulsory, and that you were supposed to have attendance, which is compulsory in it, but nobody ever has anything like that in the universities. And without physical education and physical activity, you cannot develop a healthy body. So
can I come in, Kavita ji, for a second?
Yeah.
Pankaj here. What I was trying to say, I am Pankaj Mittal, Secretary General AIU. Like the way you were saying that many of the students, the teachers, they are not aware of all these schemes. So if the ministry wants or the Niti Aayog wants, we can pitch in from AIU, because we have more than 870 universities as our members. So if you want to promote some of your schemes, you can talk to us and we can be doing it. And in past also, especially for health, we had launched a campaign called Health Promoting Universities. That was when I was in UGC. From UGC, we launched Health Promoting Universities, that how the universities can be promoting health on the campuses. And similarly, when I came to AIU, we started a campaign called Eat Right Campus, that campus should be eating right. So what type of food is available? Junk food is not there. So these two campaigns were very, very successful. So if there is something in which we can collaborate with Ministry of Health and Family Welfare for sort of health promoting university, because there are something like 3.7 crore students in higher education system today. So if they are healthy, rest can be healthy through them. So we will be very happy to collaborate with you, Johan sir.
Surely, madam, we will do it. We will be in touch with you and we'll do it.
Thank you.
Thank you. Thank you. Yes, that's a very good idea, Dr. Mittal. So, okay, next, to our next speaker, Dr. Kakoli Ghosh. Is Dr. Kakoli? Yeah.
Hello, everyone, and very good morning. Can you hear me?
Yeah.
Okay, great. Thank you. So I will start by sharing my slides. Let me know if you are watching it, but good morning from Riyadh. I'm just joining in right now.
We are watching it. Just do it in the slide. Yes,
yeah.
It's good.
Thank you. First of all, thank you very much, Dr. Sharma, Dr. Mittal, and the entire AIU team for giving me this opportunity to speak to you. I'm afraid I could not join yesterday because of some other responsibilities. So I thought I will take the opportunity today to share with you some thoughts on the interlinkages between the various SDGs and how they are connected, and what higher education institutions can do to find a way, practical way to move this forward. Because I did manage to catch Dr. Kakudkar speaking yesterday, enormously inspiring talk, I would say, to look at various components. And he mentioned rural development as one of those themes where India has a huge opportunity and a challenge to look at from the higher education perspective. Right now, my panelists mentioned any number of schemes and possibilities going on with regards health. However, SDGs, when they were made 5-6 years ago, the whole point was to make them indivisible and to make them connected. So I like to speak a little bit on the SDGs and the interlinkages, the power of an integrated approach, what can be and are the contributions of our universities, and some avenues and opportunities. Just to look at it, I thought I am amongst the most thinking people, the people who shape the world, and I'm very grateful for that. Teachers are my most favored persons, I think. And so I think there is no need to tell you that most of us may be doing something, but it is you who understand what has to be done. And that's where the crux is, how to understand the issue, how to make it move, how to make it happen for people who will not probably go into teaching. So your responsibilities are probably a notch higher than most of us, because guru, we call gurus at the highest level, almost next to God. So there you go. But the 2030 agenda probably thought about this long ago, because when it was being developed right in 2015, they put together this thing of people, planet, prosperity, partnership, peace, all these very big words. But point is that they were trying to look at what does it mean to have a universal approach where we can look at some common elements. And again, it comes from an understanding, if one person is not well, the society in a country is not well, then probably we are not looking at a very healthy future in many ways. And this is the case really wherever we see. So next, even then in 2015, they saw when they were preparing these SDGs, they put together this very complicated, very many arrows and rows slides just to emphasize what we are talking about. These goals are really indivisible and intertwined. There are 169 targets, there are 232 indicators, but again, these are really aspirations and targets to be looked at from our own perspectives, what we want to do. The point here is to look at all the dimensions. And what are the 3 dimensions of sustainability? Well, Dr. Kavita just mentioned the social aspects. That is one of the very key ones, social, environment, and economic. That doesn't mean health or food or some other dimension is not there. They are there, but it is somehow defined within the UN, the sustainability, to capture all these 3 dimensions. And we have seen time and time again, if only one dimension is followed, development is completely skewed and it doesn't go. And I'll try to share some points around it. And of course, the very lofty, very lofty goals of SDGs are to leave no one behind. To leave no one behind is a dream somehow, but also we have to understand what we mean when we say no one behind. Again, teachers, I think, are best placed to recognize what we are talking about in this context. I just start with SDG 2 because that's something I can probably say something about. I'm working where I do. If you see, broadly speaking, just as not to get worried about so many things written together, SDG 2 is really pointing towards ending hunger, achieving food security, improving nutrition, promoting sustainable agriculture, so on and so forth. And first and foremost is safe and nutritious sufficient food, ending all forms of malnutrition, increasing, doubling agriculture productivity and incomes, ensuring sustainable production systems, so maintaining ecosystems, balancing them, adapting to climate change, better soil, land quality, living where we do in India. These things are very dear to us. We understand it inherently, what we are talking about when we are saying food production systems, our rural infrastructure and ecosystem. Maintaining genetic diversity, again, India being at one of the centers of origin for a vast number of crops, including rice and chana. Genetic diversity is critical because that's where the source of nutrition and more, unfortunately more and more this is being lost and being sort of, just put in gene banks and so forth, an area where I know a little about. But together with this, we have the opportunity of increasing infrastructure, rural infrastructure, increasing investment, research, extension, technology. Each of these words can take probably one day to explain, and each of them in universities have a department on their own, but they have been clubbed together. And then comes the ones which we do, the means of these things, preventing restrictions of trade. So looking at agriculture markets, because that matters in any kind of investment that we are talking about, and managing price of food price volatility. This is again very, very important. So on the whole, SDG 2 itself is vast, complex, and provides multiple entry points with these 8 targets. And there are 13 indicators, which are also extremely complex, but I don't want to go into that. What's important to note is, despite all that, there are irreversible and unsustainable trends in food systems, in water availability, in biodiversity loss, and in climate change. I don't always like to mention this in these presentations, but this is fact that all SDGs are off track, more or less, all of them on the global level. And this was already beginning to happen before the pandemic. If you look at water, which is SDG 6, and the session I think will be just after that, it is something that we are all struggling with in terms of agriculture is the most important user of water, what kind of water use, food production, how it matters. Hunger numbers have increased, was already increasing. Malnutrition particularly was also increasing. We have had many big conferences, including the very, very famous COP26 that was just held in terms of climate change and the huge amount of increase, whether we can get down to 1.5 degrees and so forth. And then the biodiversity loss. So again, this COP was also held last year, and it reiterated that in general, we are simply reaching the planetary boundaries, and something has to be done very quickly, very drastically. Once again, it's not just one government or one policy's job in this. We are all in it together. It has to be a much more holistic and uniformly agreed approach for these things. Talking about off track, well, the pandemic has done its contributed very solidly to that, and these are the latest reports from the UN. It has exacerbated world hunger. It has reversed or reversing the progress made in SDG 3 in good health and so forth. And you can just go into that website. It doesn't make very good reading, but what it gives us is raises some alarm bells. So if suddenly in couple of years, we have almost all of us become so backward in any of these goals we were achieving or trying to achieve. So the question almost arises, what on earth were we doing before that? That in just couple of years, all the parameters of improvement are falling away by like thin cards, like in a domino effect. This is a huge pandemic, but everything is coming apart. There must be some consideration and policy and deep thinking going on, that what were we achieving in the first place that we are facing this kind of very drastic situation in terms of many of the SDGs. So no wonder in universities and are being called in to play an even greater role than before, because you understand, you deal with it every day when you are looking at students, when you are dealing with university courses, or in the society itself, when people just walk up to you to find out, madam or sir, I want to do this, what is your opinion? You understand the interlinkages. You understand what can be done to shape the future of the student, shape the university's role in these kind of issues that we are facing. What can be done by the academia to invest in this research, the discovery, the technology, the creation? Globally, you see academia played the first role in actually shaping these SDGs. They were the ones who prepared the markers, the targets, the indicators, and so forth. But now the challenge in the implementation is even more, because there's a need to understand, there's need to assess and analyze the policy options. Higher education institutions are the best placed to look at them. There's a need to monitor progress, because if the government, which is responsible for delivering the SDGs, is monitoring its own progress, then there is something not happening right. There must be some more independent monitoring of progress, of what is the progress of the targets, what is the progress in the indicators in local and national level. Teaching professional skills, we heard of a raft of courses that are available, that are increasingly being made available. Are they really looking at SDG implementation? And again, the point here is not SDG implementation per se. The point here is through this vehicle, perhaps some of those targets that they were already presented in the university or national education policy or somewhere, these can be achieved and also streamlined to showcase and recognize the importance of teaching the SDGs to a new generation continuously, providing leadership around cross-sectoral issues, educating general public awareness. We heard again Dr. Mittal asking about the need for an awareness campaign, trying to move people around, bringing together. I remember we participated in several interesting something like Eat Right course, something called PUSH, where presidents of universities against hunger and such initiatives from FAO. Then also, there is a very important need to be an independent voice. This is something necessary and essential. You understand, you analyze, and you present the data. What is there and what is going on? Where are the gaps? Where are the issues? This is essential. And now with the pandemic on and receding and new ways that have to be looked at, perhaps even greater responsibilities on you, ladies and gentlemen, in your professions to look at these things. So question always becomes how. These are all very nice things to say, but the question is how. And I would like to present SDG 2 as an entry point, if you may consider. This is particularly in the perspective of India. And what I was trying to present here is just link the SDGs and where are the synergies and trade-offs. And as I mentioned to you, SDG has these 8 targets, and these targets are very broad and complex, but also they link to water, SDG 6, to health, SDG 3, to land and forest, SDG 13, 14, 15, you name it. They are all linked, and climate change, agriculture and climate change, food and hunger, climate change, and particularly SDG 1, poverty, good food, and reduction of poverty. These are proven. So we don't have to go to argue why it should be like that. We can imagine this as a strategy, how you can deal with the various challenges, the targets, the indicators, and so forth, and see which is the most convenient way to handle them in a localized manner where you are working and what you can do about it. I just wanted to mention one particular SDG linkage. It is with the SDG 5. Ending hunger and improving nutrition is crucial for women due to their roles in food production, childcare, and preparation of food. Now you see, in this big picture, we always, although SDGs were the first time which dedicated an SDG exclusively on gender equality and on women particularly, this is our opportunity, even to consider how to bring this at the topmost of the top level, because women do hold the key, particularly in India, where we are looking at an array of issues, handling gender issues, which matter also at the rural level. So that, I think, would be one of the most important shape-shifting connections, if it can be established much more concretely, including by the higher education institutions. Now, why should we do that? Well, we know we can adopt a strategy, but the question is why we will do that? Who will benefit from it? From my perspective, I would start with the smallholders. Smallholders will benefit the most. And in your belt of the Central Universities region, I was trying to sort of quickly skim through the range that you have. There's almost a very strong percentage of India's rural population based in that entire region. So they will benefit the most. Rural women, I mentioned. Forest communities, again, Central University has a very strong forest community. Indigenous people, fisheries sector. In fact, the whole of India will benefit, not just the Central University region per se, the entire, because this is the kind of power we have if we are looking at these targeted areas and trying to move them together. Now, how? this is what I think. Okay, we know now what we can do. We can argue why we need to do that. Now the question is how. So the first how I thought would be very, very simple is simply mapping. This I just presented something that was happening when we were in Rome, based in Europe, Western Europe. What they did is basically try to bring together all the good work that was going on, trying to link it with the various SDGs, you see. So this is a no-brainer per se, because a lot of initiatives are going on probably in all your institutions.
Dr. Ghosh, you need to start winding up.
I will. So
You have
it
2
would
minutes.
it would be very important to see how to do the mapping. Just mapping would give you a roadway of where you want to go. Second point would be to look at these indicators. And here I have mentioned what Niti Aayog is doing. Is India is looking at the indicators. You see, India has not taken up all the indicators of SDG 2. It has just chosen these and for its own reporting. And the point here is it will probably go and increase and look at the other indicators as well, but maybe the data is not adequately available. Maybe this is where you have to look at much more concretely of what we are talking about. Third point is the most fundamental systems approach. Are the higher education institutions really looking at systems thinking, the integrated approach of scaling up, scaling deep, and scaling wide? There is a whole raft of linkages that have to be organized, from energy management to erosion management to fisheries to wetlands. But the point again here is, it is the universities at the higher education level who will appreciate and understand what a systems thinking needs to look like, how it can be achieved, and what needs to be available and done about it. Finally, measuring impacts at the local level. This is a map from the NASA map of a hugely important aquaculture of India in Andhra Pradesh. This is the largest aquaculture sector of aquaculture, where it has now increased India's shrimp production as one of the largest in the world. Now the question really is, that's great, shrimp production has increased. What happened to the rest of the ecosystem? What happened to the indicators? What were the trade-offs? What happened to the rest of the farms and farming communities, health of the people? Because shrimp production also includes a lot of health consequences. This is the question that only higher education institutions around and in and around there can look at concretely and together. So measuring impacts, looking at circular economy, again, bringing together a number of disciplines, departments, interdisciplinarity. I just mentioned something in the passing. SDG 2 needs all these, from environmentalists to curious people at the same time. But the fact is, you understand and you know this, from engineering to AI to simply farmers. These are the kind of people who have to come together. But how to shape and organize this is the challenge, and no better place than higher education institutions, AIU per se, to consider these, to look at them together. So with that, I would like to thank you, just to remind us, education is the most powerful weapon which we can use to change the world. Thank you very much.
Thank you so much, Dr. Ghosh. I'm sure higher education institutions will live up to what you expect of them. May I now request Dr. Poonam Muthreja to share her thoughts with us.
Yeah, Kavita, just coming on. Pulling up my slides.
Yeah.
मेरा वो नहीं है, okay. Thank you very much, Professor Sharma, and my distinguished co-panelists. It's an absolute honor to be here with you and to talk to a very important institution. I'll just use a few slides on health because my co-panelists have done a great job of giving us a sense of the health scenario in India, especially in the context of young people. But I would like to begin by saying India has made huge progress in some areas, especially on MDGs, which were mentioned by Kavita, which came before SDGs, and the areas that, thanks to partly India taking MDGs seriously, we made huge progress on maternal mortality ratios. We, as you can see from this graph, and we also made huge progress in meeting unmet need for family planning. Life expectancy at birth has decreased several times. And I would like to say that a big concern is anemia. Let me quickly deal with some of the challenges which were mentioned, which I want to highlight, but some new challenges that haven't come up in our conversation in our health system. Low levels of government investments have been referred to. Diverse geography needs special focus on tribal areas, hard to reach areas, especially as Professor Kakholi said, we are the SDGs, SDG 17 is about leaving nobody behind. Shortages across human resources is one of the biggest challenges our public health system is dealing with and the health ministry is dealing with, and making every effort, as we heard, in terms of increasing colleges, but at the medical colleges, but at the sub-center level, which is where a large number of very poor people who don't have access to private sector do go, and that is 62% shortage of male workers, 48% PHCs fall short of female health workers, 60% of them fall short of male health assistants. 44% of PHCs in urban areas do not have an A&M, and hospital beds per 1,000 population is very low if we look at the world standards and expectations, and of course, shortfalls in the rural infrastructure. Yes, there are increasing investments, as was mentioned by JS Policy, Mr. Chauhan, but at this point of time, the numbers are, I would like to say, numbing when you look at India. It's a huge country. But two areas I would like to mention specifically where there are missing components is health literacy, preventive and promotive measures, vulnerability, and a focus on social determinants of health, which is where the universities can play a key role. And of course, failure to address health-seeking behavior. There is a huge challenge there and a huge need there too. There are, I mean, I hardly need to say to this audience, the number of universities in India are huge, as are the colleges. But again, as I said, numbers are numbing. 38.5 million people is what we are talking about in our universities. Of course, there is, again, regional variance where you have, which varies from 7 in Bihar to 59 in Karnataka as compared to the average in India, which is 30. Now, health is wealth, and unless health improves, wealth cannot grow. India has made considerable progress, as we saw, but in India also fares poorly on many indicators, and I think the colleges and universities can play a huge role. And let me begin to share how and why in the rest of my presentation. So higher education, as was also articulated by Professor Sharma, is the key catalyst for promoting socio-economic development and preparing our citizens with new skills, broad knowledge base, and a wide range of competencies to enter a complex and interdependent world. The SDGs are a great example of how much interdependence there is, and we saw some of the interdependence mentioned in the last presentation very ably. And India is, so when it comes to young people, India is home to about a fifth of the world's young population. The country's median age indeed is 29 years. And as this vast, since we have a vast resource of young people who would be entering the workforce, we know that India stands and has the window of opportunity for a demographic dividend. And this young population can contribute to both nation building and the economy and become as future leaders too. Higher education institutions do indeed offer a unique opportunity for dynamism and for the country's overall growth. And emphasis on the concepts of health and well-being in higher education is critical to build a strong foundation for the future of the country. And I really welcome the fact that the organizers have brought in health and such a powerful, strong panel. As was said earlier, the international community through Goal 3 has committed itself to efforts in, eradicate disease, strengthen treatment and healthcare, and address a new and emerging health issues. It calls for innovation, research, and a holistic approach to quality, affordable, equitable, universal access to healthcare. You know, I was in New York when the SDGs were released at the UN headquarters, and I want to tell you that whether it was the head of a country that spoke there or the global experts who spoke, everybody said, SDGs will succeed if India succeeds. Well, it has to do with our large numbers. And I do hope we will show to the world that we do succeed in spite of some of the setbacks that COVID has brought in, but the seriousness with which India is monitoring, especially Niti Aayog, I want to refer to, there is a huge, and Professor Sharma referred to how we need to monitor and measure the impact. And clearly that is something that Niti Aayog is doing. So the notable targets for SDG 3, I'd like to say is we can focus on development, training, and retention of the health workforce in developing countries. Achieving universal health coverage is the key if we want to succeed on many of the SDGs, not just SDG 3, and including protection from financial risk. We know that a large number of people get indebted due to catastrophic illnesses, not only ongoing illnesses. And we need access to good quality, affordable, essential medicines and vaccines. And by 2030, a part of the target for SDG 3 is to ensure universal access to sexual reproductive health services, including family planning. And in fact, I was doing we have a mapping we've done of the linkage between family planning and all SDGs, and we found that unless we invest in family planning, we cannot achieve many of the SDGs, or it'll be difficult to achieve many of the SDGs. Strengthening and prevention of treatment of substance abuse has been mentioned by many of the speakers, and Dr. Sharma highlighted that too. And supporting research and development of vaccines and medicines and communicable diseases is another area. So how can higher education institutions contribute to SDGs? The first I'd like to say is create and deliver context-specific health education. You know, health literacy is something that India has not invested energy, money, or intellectual capital in. And generating awareness about healthy behaviors and entitlements available in the health services can truly shift the paradigm towards prevention and health promotion. There are estimates to show that 50% of the diseases can be prevented by good prevention strategies and health promotion, hygiene. And these are areas where, you know, our young people can play a huge role, and the universities can invest in bringing in health literacy and health awareness along with behavior change communication. Promoting self-care amongst young people is truly really important, not just from the mental health point of view, but addiction and a whole lot of areas. Self-care is becoming globally an increasing a way of life to deal with health issues, and no better lesson than from COVID pandemic of self-care we've received, and people have truly changed behaviors and changed their lifestyles in a very, very short period of time. So there's great hope for us to invest in that. Dispelling the myths and misconceptions around sexual reproductive health, family planning, and so on is a very important health education, which should include sex education and life skill education for young people. Conducting mandatory gender sensitization trainings. There are plenty of trainings available in India, and not just with NGOs, but academic institutions. This will lead to clearly gender equality, will greatly help on issues like violence against women, decreasing violence against women, which is unfortunately on the increase, and the pandemic has further exacerbated that, as well as looking at social determinants of health, like gender equality, etc. Leveraging, leveraging technology is something I want to reiterate, as did others, that in the post-COVID world, the reach of using initiatives, education, using technology has further enhanced greatly in India, even though there is a digital divide and a gender divide here. Population Foundation of India, where I work, has developed a digital tool called Educately, for example, for educators and students to under concepts of mental health, mental well-being, reproductive health, sexual health, and strengthening teachers on how to deal with the students in the classroom on these very complex and difficult issues which impact mental health issues faced by young people in a big way, which, as was mentioned by many of the speakers, has got further exacerbated. We have used technology in many, many different ways, and I would love to, I would really like to connect with Dr. Pankaj Mittal to see how we can offer these courses and tailor make some of the courses for the needs of universities in India across regions. We also, PFI, I don't mention in the slide, but we've developed huge amount of behavior change communication for the government of India, for Doordarshan, for digital use, which young people, which has been evaluated internationally and nationally to show the impact. And I would be very happy to make that available again to you, Dr. Pankaj Mittal, should you agree. Higher education institutions need to go beyond, I would like to really say, establish themselves, go beyond traditional ideas of education, and in the area of health, especially health research, innovations and excellence and building capacities of young researchers, which is done all over the world, especially in the Western universities. I would like to end with a quote, but before I read out the quote, I'd like to say that if India fares poorly on the Human Development Index, Human Capital Index, Global Competitiveness Index, it is largely due to one poor performance, which is the health sector. And I do want to, and nutrition. Reasons for this is the continued, of course, underfunding of public spending on health, but also the neglect of the primary health care and the unregulated expansion of the private sector. And if we see health truly as wealth, we need to invest our wealth in health. And I would like to end with the quote that the most important and urgent reform needed in education is to transform it, to endeavor to relate to the life, to the life, needs, and aspirations of people, and thereby make it the powerful instrument of social, economic, cultural transformation necessary for realizing of our national goals, not only SDGs. For this purpose, education should be developed so as to increase productivity, achieve social and national integration, accelerate the process of modernization, and cultivate social, moral, and spiritual values. And this is, for me today, as I was looking at my presentation, Dr. Radhakrishnan's, the former president of India's quote becomes very relevant. And I do hope that the changing aspirations of young people will be matched by the response of our universities. Thank you very much.
Thank you so much, Dr. Mutreja, for a very succinct presentation. Thank you very much. We move on to our last speaker, Dr. Indrani Gupta. Is Dr. Indrani Gupta there?
Yes, I'm here.
Yeah, okay.
Thank you very much, Professor Sharma. And thank you, AIU, for inviting me for this excellent session. I'm really happy that all of the experts and stalwarts in the health sector have spoken before me. So I really have very little to say, especially because we're out of time. I have no slides because Dr. Rama, who has been really persuasive for me to come for this talk, I told her that I probably wouldn't put up slides. So let me just talk a bit about what I think. Since this was about how higher education institutes can be involved to further the goals of the SDG 3, I wanted to give you my thoughts as an economist, as a social science researcher, and as an officiating director of an institute, and also the head of the Health Policy Research Unit, which is one of the few units or centers in India that does health economics work. So my take on this is that we know that there is a growing pressure in the health sector to provide quality, cost-effective, patient-centric care. And so what is happening in the world is that healthcare professionals are now increasingly turning to what is called health outcomes research, which is basically evidence-based guidance for health policy. So we need to really produce evidence of what works, how, to what extent, when, where, and of what quality. For all of these questions, we really need solid research. Now, I'm not in the medical research area, and but what I have read so far, I was just reading something yesterday. It seems to suggest that a small percentage of our medical institutions and hospitals, about 5% is what that paper says, produce more than 100 papers a year, compared to the huge research output of hospitals and teaching colleges in other countries, especially in the developed world. And we would like to be counted in that group. So we know that biomedical research and public health research has really taken a hit over the years in the country. These can be hugely improved to produce good, solid scientific research as well as for evidence. Now, how do we translate the science that we have into practice? For that, we need translational research, right? So which includes two areas of translation. One is the process of applying discoveries generated during research in the labs and in preclinical studies to the development of trials and studies in humans. And the second area of translation concerns research aimed at enhancing the adoption of best practices in the community, in the society. The cost effectiveness of prevention and treatment strategies is also an important part of this translational science. Now, while the pure science and the medical science needs solid training, the latter of translating to the best practices in the community needs, for that, we need a good grip on various subjects we broadly call social science. And now, Poonam, we go back a long way. So I am happy that she spoke about social science. That is where social science comes in. Now, we are really inadequate in that area of research. Social science is not still a big part of health research in the country. Now, we have been familiar with the social determinants of health for a very long time now. So we talk about every other determinant: education, poverty, gender, race, class, caste, religion, all of that are the social determinants of health. And we need to get a good grip on how these work themselves through the health sector. We also had the Commission on Macroeconomics and Health. And the recent COVID experience with shrinking output and employment has generated enough reasons for health, social science research, and especially health economics research. I'll be a little partial to health economics. And also, we have generated hundreds of questions that we need to answer that would be very useful for policymakers. Now, Dr. Narwal has spoken, Dr. Sarwal has spoken, and also Mr. Chauhan from the ministry have heard all the questions and all the good work that the ministry has been doing. But I still think there remains a disconnect between policymakers, program managers, and good research in India. We did a study to look at how much economists have participated in studies on non-communicable diseases and injuries in India. There's a paper we published on that. It was a systematic review. And interestingly, we found that very few studies use economic techniques of analysis in the context of NCDIs in India. And those who do use economic techniques generally focus on the more widely known areas of costing, economic evaluation, and out-of-pocket expenditure. And only some diseases like CVD, diabetes, and cancer were being studied. The most important point was that most of these studies were led by clinicians and other public health professionals and not economists. And the reason being that for a clinician, it was easy to get the sample. You know, they work in these hospitals. So it was facility level data that they were using, and it limited the scope and generalizability of the studies. And these were also very inadequate because only a person who has been trained in economic techniques possibly can go the whole breadth and do a better analysis. So that's not to say that we are putting it down. What I'm saying is that somehow we have not made enough efforts to get other social scientists interested in the health sector. Now, for instance, the Journal on Social Science and Medicine, which is an international and interdisciplinary journal, is a very good example of the wide range of social science disciplines that can go into health studies. Anthropology, economics, epidemiology, geography, political science, psychology, sociology, all of these are part of the social science and medicine clientele. They all send papers. Now, why don't we do have a few journals in India that publish, public health papers or social science and health papers, but somehow we don't have the stature of social science and medicine and many other international journals. So this is an area that, since we were talking about education, higher education, universities, colleges, etc., I thought that is what I would focus on. I think this needs to be really strengthened. Now, I'll give another example. Mr. Sarwal and Mr. Chauhan, and I think many of you spoke about, for instance, the PMJ. The PMJ is a very important program that was launched by a prime minister with a very noble intention. Now, my take on this is, and I'm sorry if I'm sounding a little critical here, is that if enough people with health economics and health social science background had put their heads together, then maybe we would have come up with a better design of the PMJ. We call it the universal health coverage, but it's not UHC. It has never been UHC. So why is it not? I mean, that's I'd work on that. It's my area. So I don't want to launch into that. But, it's neither universal, nor does it pool across income, nor does it pool across risk. A kind of a fragmented health coverage system is actually ultimately detrimental to this to the goal of UHC, because it kind of introduces what in economics we call biases in the health system, right? So we don't want to actually do that, but somehow that message has never been could not go through. Now, the Finance Commission, the last one, asked us to do the costs and finances of PMJ, and we did it and presented it. And we've shown how we require a huge amount of resources if we have to do it well. That is 100% coverage of all the target population, etc. So all of that comes from research that one does. Now, what has happened is that in health economics, economic evaluation studies, especially cost effectiveness studies, have become as though that is what health economics is all about, but it isn't. The fact that we have been able to reduce the entire area of health economics to something called health cost effectiveness is a rather sad commentary on what is happening in health economics and how we can inform policies much better if we take in other economists who work on various other things, demand, supply, elasticities, subsidies, poverty. All of them need to also come in. And of course, I will not say that I don't see the use of other social scientists. We do need social scientists like anthropologists and sociologists, for instance. Now, I'm currently in a group set up by the WHO and others that tries to merge epidemiological models with behavioral models, right? Which is a new cutting edge approach to understanding pandemics like the COVID. Now, behavioral science is basically the systematic study of human behavior. For example, in the London School of Economics, they use observation, interviews, surveys, experiments, etc., to develop and test theories that explain when and why individuals behave the way they do. And this is exactly what economists, other social scientists, political scientists, anthropologists do, which needs to get into the mindset of our program managers and policymakers, so that better policies can be devised. Now, so my question is, can HEIs help towards this goal, towards bridging this disconnect or bridging this gap? Absolutely. I think the HEIs play a major role in promoting better health outcomes in India and SDG 3. How we basically, there needs to be some movement that reaches out to the centers of excellence in social science in the country. Not only as we are, for instance, I'm on many committees, right? So you say, oh, you are there. I mean, people like you are there in committees, so why can't you help? it is not that. I mean, at the end of it, I go to a committee, I pontificate for 3 minutes and then come out. That's not what I'm saying. You need collaboration and cooperation between the policymakers, and I'm putting all of them in one basket, and the researchers and teachers, because most teachers are researchers. I mean, they should be. If they're not, then there's something wrong. So all teachers are also, they can also be good researchers, and vice versa. There are, for instance, we have the Delhi School of Economics, we have the JNU. We know these are all centers of excellence. Why can we not make inroads into working with, into these departments and see what they're working on, and whether if there is a demand, there will be supply. So, I mean, as an economist, I have to bring back that examples. If the policymakers demand that your department or your unit must work with us and help us in this, that, or the other, it would happen. It's happening. It's not that it's not happening. The ICMR works with a lot of the institutes, but I'm also talking about going beyond just the science and the medical science institutes. I'm talking about other social sciences, especially the different disciplines. We have in IEG, in my Institute of Economic Growth, the PRCs that were mentioned, I think, by Mr. Chauhan. And they had some of the best demographers in the country advising the government, like Ashish Bose, etc. Somehow, somewhere, that has declined. The PRC quality, I mean, everywhere, all over India, and the need for them to give inputs. What has happened is a lot of reports get produced, but not the cutting edge methodologies and are coming into the applied research. So now I am on the board of NHSRC. We see some extremely bright youngsters working with such organizations. Again, people are working in their silos. So what I'm suggesting at the end of it all is that the need of the hour is to expand the group of experts who can work with medical and non-medical health researchers and professionals and work together. Systematically, we need to build collaboration, which is basically some line item in the government, but say X institute is working with us for the next 5 years or something like that, which is there, I know, but much more of that with social science institutes. And training. We somehow are falling behind in the cutting edge methodologies that are being applied elsewhere in the country. When you look at the COVID research that has happened elsewhere, it's absolutely mind-boggling. Do we have a lot of that? No, we don't. We have a little of it, but not a lot. But we need to have a lot of it, and the HEIs can actually help. We need to also fund them for training so that they come up with, they can learn these new methodologies in their respective fields. So whether it's behavioral science or it's in sociology, some methodologies happen. All of that must happen and happen soon. In colleges, we can have early germs planted. Somebody mentioned that also by special curriculum, changing the curriculum slightly to include health and the linkages with other sectors like WASH, etc. Some things must go into the minds of the students so that later on when they come to their postgraduate level, they want to actually do things like health and economics, health and sociology, health and pol science, all of that. So finally, I want to stop here by saying that we have come some way, but not the whole way. We really need to bridge the gap between training, research, and policy making, and do that fast so that our universities are also counted as some of the best in the world in health research. That is the only way we can help this particular SDG goals. Thank you.
Thank you very much for highlighting what the social sciences can do. Somehow they get just fall by the wayside, whereas they are very vital in actual research and implementation of any scheme. Thank you so much. I'm sorry we've run out of time. We had such exciting speakers that there was nothing, I didn't want to interrupt them. Now, we have a rapporteur in Dr. Raksha Chauhan. In 2-3 minutes, if you can wrap it all up, I'd be really grateful.
Yeah. Thanks a lot, ma'am. I feel privileged to propose vote of thanks to all the respected dignitaries for sharing their wisdom words in different aspects towards ensured health, life, and well-being. I express my gratitude and lot of thanks to Dr. G. Tiruvasagam, Dr. Upinder Dhar, Dr. Kavita Sharma, Dr. Rakesh Sarwal, Mr. Vishal Chauhan, Dr. Kakoli Ghosh, Dr. Poonam Mutreja, Dr. Indrani Gupta, Dr. Pankaj Mittal, Dr. A.K. Mishra, Dr. Alok Mishra, and all the directors and vice chancellors from various universities. Thanks a lot for sharing your knowledge with us. At last, I am thankful to editor Dr. S. Rama Devi Pani for her constant guidance and support, and I am also thankful to Nodal Officer of S3V, Dr. Anand Rajavar, for his constant guidance. Thanks to one and all. Thank you very much. Moving ahead, we have another session, and it's an honor for me to start AIU business session, which is very important session of this conference. And this session focuses on regional or national problems faced by the individual vice chancellors in the discharge of their duties, which they can think can be solved by the collective wisdom or collective efforts of all the member vice chancellors. This session is also a knowledge sharing session for unique best practices which can help the fellow vice chancellors to improve the functioning of their universities. With this, I would like to invite Chairperson Dr. G. Tiruvasagam, President AIU and Vice Chancellor, MH University, Chennai, to give introductory thoughts. Over to you, sir.
Before we do that, may I close the session and thank all the panelists that who have been a part of this session. Thank you very much. I don't want to interrupt the next session. Thank you so much.
Thanks to all the panelists. It was really a wonderful session.
Thank you very much.
Really a powerful, power-packed session. Thank you very much.
Madam, I also want to thank on behalf of AIU, Madam Kavita Sharma, and particularly Shri Rakesh Sarwalji and Vishal and all the speakers of this session to spare their valuable time early in this morning and coming here. Gracing this.
Thank you so much. Thank you.
Thank you very much. This Dr. Raksha for inviting us to convene the business session of the meeting. First of all, I should say good morning to Secretary General, our beloved and respected Secretary General, because I didn't wish her in the morning. How are you, madam?
Fine, sir. Thank you, sir.
Thank you. Honorable Vice President of Asuna Indian Universities, Dr. Surandan Das, beloved and respected Secretary General of AIU, Dr. Pankaj Mittal, Honorable Vice Chancellor and Governing Council Member of AIU, Professor Dr. Upinder Dhar, respected Governing Council members of the AIU, respected colleagues of the AIU who are present here, most importantly, the participating Vice Chancellors of Central Zone Universities of India. I welcome you all to this business session. Dear colleagues, indeed, I consider this business session is most important, especially during the current COVID-19 environment. Though AIU has around 870 member universities and there are around 180 member universities in the central zone, we didn't get an opportunity to meet and share our experiences for the last 2 years. There were years and there were days. We used to mingle and meet along with the family members of us in the national and zonal conferences. Because I have been in this higher education system for the last 5 decades and as a Vice Chancellor for the last 16 years. I had an opportunity as attending many conferences of zonal and national conference as well. Even moreover, the top executives of the apex bodies like Chairman of UGC, Chairman of AICTE, Director, NAC, Chairman, Medical Council of India, Secretary to Government, used to attend our conferences and interacted with the Vice Chancellor also. These are all days I cannot forget in my life. Unfortunately, the present scenario is totally different. Despite our invitations, top officials are not able to participate in the conference and seminars. Of course, they debut to their deputies. They are also interacting with us very well, for which we are very much grateful to them. But even today, we are not able to see any official from UGC is participating invariably in all the programs. Of course, they are the topmost apex body as far as higher education is concerned. Hopefully, they will be coming to us, attending our invitation, at least in the near future as well. Further to add, the Vice Chancellor's response for the invitations of AAU is also very, very poor and not encouraging. Even for the virtual conferences, the participating Vice Chancellor is not adequate. I was told by our Professor Ubendra Dar, the Vice Chancellor, there are around 160 Vice Chancellors in the states of Central Zone. I have seen them large in number in the inauguration. Now, even inauguration itself, I specifically mentioned that and invited them that they have to participate large in number in the business session, which is most important. Now I see the total participant comes about around 60 only. Oh, this kind of not showing interest with the activities of AAU, it's totally discouraging factor to the officials like me in AAU as well. See, I can quote you a few more examples also, how we are not able to draw the support, the understanding, and the participation of the Vice Chancellors. For an example, the National Education Policy 2020 Implementation Committee, the Chairman, Dr. S.P. Tyagarajan, sent a questionnaire in a Google format to all the 870 Vice Chancellors and Directors of the universities and institutions. It was a surprise to note only 92 Vice Chancellors responded and replied. One side, we say we have reservations and difficulties to implement the national education policies. Other side, we are not prepared to represent the same by filling up the questionnaires. My dear colleague Vice Chancellors, as you are well aware that AAU is the only platform available for the Vice Chancellors to speak and to submit their grievances with the ministry and the apex bodies of higher education. In general, if you write as a Vice Chancellor to the apex bodies, either you will not get reply or it will take at least 6 to 12 months to get the reply from the apex bodies. This is a situation right now. As a matter of fact, AAU at present work beyond the regular activities, regular programs, regular mandate. Yes, AAU, I personally felt that AAU should play vigorously to serve like a representative body besides academic and research supporting body. Of course, they have been doing all these activities for the last 96 years, by which lot of developments have been taken place, lot of help has been given to member universities. But the time has come. There are issues, there are grievances, there are problems for the universities to reach and represent their own problems with the concerned bodies. Now it is the right time. Even when you go through the objectives of AAU, it is very clearly mentioned, very specifically mentioned that the AAU should act as a representative body for the member universities as well. So my dear friends, AAU is very, very upset on certain aspects and treatment of the apex bodies also. See, I don't have any hesitation to speak openly as well. See, we conduct many conferences of these regional and national conferences. Even apart from all these things, we conduct academic research conferences. We come to a conclusion with recommendations. All these recommendations, with all efforts of Secretary General and officials, we made it as a booklet, we made it as a report, and to submit to the concerned bodies as well. Out of my knowledge, even we don't get even a good response and reply or acknowledgement from these bodies. So there is no meaning at all spending time inviting experts, discussing many things, and with all expectations submitting our recommendations to apex body when it's not considered even. That is the pathetic situation as it is as far as higher education of institution of India is concerned. Is it okay? Therefore, decided to knock the doors of the apex bodies. I have been doing for the last 6 months after assuming charge as the president of the AAU with the support of the ever dynamic Vice President Dr. Surandan Das, who is going to take responsibility as the president within another 5 months, and our Secretary General, Dr. Pankaj Mittal. At this juncture, I have to tell about Dr. Pankaj Mittal. Without Pankaj Mittal, now we cannot see whatever success we see today at AAU as well. Yes, she is very, very knowledgeable because I have more proximity than you. I have been working with her for the last 6 months. Out of my observation, she is the personality, she is the administrator, and she is looking after A to Z of not only AAU, all the aspects of the higher education system and all the universities, member universities of AAU as well. And with her experience, vast experience with UGC, she has wide contact with all the officials of UGC, past and present, and all the vice chancellors who are working. They were with Pankaj Mittal when she was the joint secretary. And her experience as the vice chancellor of a reputed women university, we are able to get a lot of dynamism from her, lot of expertise from her. So this kind of official is very much required. And God's sake, we are very lucky enough for another 10 years, the AAU will in the safer hand of Dr. Pankaj Mittal. That is my wish and prayer. That is one of the very big advantage as far as the AAU is concerned. My dear friends, and for a kind information, taking things very seriously, we met the chairman of UGC, AICTE, NIRF, NBA, NAC, presented memorandums on many issues. We have succeeded in our attempt also. I can quote a few examples. Number one, only the universities which have A+ NAC grading were permitted to offer ODL and online courses. After our representation in person and through memorandum, the eligibility brought down to A-grade institutions as well to offer ODL and this online program as well. This is it is all because of the earnest effort taken by our AAU as well. Number two, fee for filling the pattern. Public universities were exempted and private universities were asked to pay huge amounts. After getting representation from private universities, and Dr. Pankaj Mittal take it as a challenge, drafted a memorandum, and we went to the Secretariat of the Commerce and Industry. We met the secretary and briefed everything, why there is a disparity between the private and public, and private universities' contribution in terms of patent filing, publication, award is really high. Likewise, we fought with them, and as a result, we have got a very good outcome of our efforts. Now, the patent filing and other related fees drastically reduced. So that credit also comes to the AAU as well. And the third one, I am for every organization, I am getting only due to time limit, I am quoting only one example. Come to the AICTE. Being the president of AAU, I was nominated as the member of the Executive Council of the AICTE as well. There was only one meeting held so far. In that meeting, I have taken issues of 4 universities who are represented through me. I placed that 4 grievances and addressed very briefly in the Executive Committee meeting. And you know pretty well, President Chairman AICTE is a very, very positive-minded, very proactive person as well. He listened to my address, he listened to the grievances. On the spot, the meeting itself, he has given positive decision, and a decision communicated to the concerned university as well. In due course, it is going to happen like that only. Likewise, come to the NAC. NAC, everyone, we have to deal with the NAC. really, we have met Dr. S.C. Sharma. He is also a proactive official on many occasions and represented many matters related to grading and accreditation as well, out of which accredited period has been extended due to COVID. Likewise, the SSR submission period also extended for another 9 months to 1 year. These are all the efforts made out. And we have made another important thing. See, just before 2 years, there was a provision of opt-out criteria in the SSR. Probably you might have known opt-outs. Recently, after this new format framework, they have left out opt-outs because all the universities cannot attend all the criterion, all the questions. Some of them may be unique. It may not be very much suitable. Out of our representation, now they have assumed that opt-out provision is going to come again in the new format. That is an advantage. Another thing, for the last few years, universities of sector focusing and unique universities and de novo category universities wanted some exclusive manual for this accreditation purpose. The universities of finance and forensic, performance arts, sports, and maritime. And we have been with the NAC for many occasions through memorandum or through meeting. As I told in the inauguration session, now NAC has taken a decision and brought out an exclusive manual for specialized category universities. So these are all the things we have made it, and still we are working with these people. My dear colleagues, I am confident that such a crusader will continue for any kind of grievances in general or particularly with the university will be addressed. Because now the AU is very, very lucky to have well-experienced spokesperson, well-experienced worker, rather to say, and a knowledgeable expert vice president who is going to take charge within another 5 months. He will do his level best with all effective efforts, and the same crusader will continue. I am a lot of confidence on him and Dr. Pankaj Mittal as well. And my dear friends, after meeting all these people, I don't want to repeat it. We met the Minister of Education, Dr. Dharmendra Pradhan also, and briefed everything as well. Likewise, now AAU is acting like a representative body and taking the issues collectively and represent and getting things are materialized. This is for a kind of information. And regarding the new programs, and you know pretty well, and women behind all these programs is our Secretary General. During her presentation, she will come out with all details. But for another 5 minutes, I would like to brief very few programs which have been introduced after I have assumed charge as the president of this current academic year. My dear friends, we have formed almost 6 committees. We felt there is a need for committees. Committee has to discuss, deliberate, bring out recommendations. Those recommendations should be useful both to the apex bodies and to the universities. Under that, NEP Implementation Committee under the headship of Dr. S.P. Tyagarajan, and the secretary of the committee is Dr. Kaliraj, the Vice Chancellor of the Bharat University. And second committee is ranking, rating, grading, because we have a lot of apprehension and grievances about NIRF ranking and NAC grading, likewise NBA and all, for which a committee has been constituted with the presidency of Dr. P.P. Sharma, our former president of AAU. Then there is a student welfare committee headed by Dr. Swandan Das. So that committee has already completed the report and submitted the report as well. And another committee, disability welfare, and Dr. Punia, the vice chairman of the AICT, is heading the committee. He has also submitted his report. And one more, consultation, incubation, and entrepreneurship development committee under the headship of chairman of the NBA, Dr. K.K. Agarwal, that they are also going to submit their report before the end of this month. And the bylaw of the AAU not revised for the last 1 decade. Keeping in mind to update the bylaw, another committee has been constituted under the headship of former president of AAU, Dr. Ravinder Singh. All these committees almost they have completed, and we are going to place all these reports in the ensuing County Council meeting, which will be placed in the appropriate body, and a copy of the committee report will be circulated to all the member universities as well. And moreover, my dear friends, second one, I also felt there is no direct link between AAU and all the universities. Vice Chancellors knows what is AAU, but the faculty members of the university, most of them, they don't know what is AAU. Students, they don't know what is AAU. To popularize AAU, now we have formulated certain schemes exclusively meant for member universities. That has been finalized and got approval, launched during the last zonal meeting. It will come to all the Vice Chancellors within another 10 days, the form of a booklet along with the application pro forma. That is going to be much useful for all the universities to have direct link with the AAU. And it will be useful to the student and faculty as well. What are all the schemes? Scheme number 1, AAU joint conference with each universities. Yes, token of funding support of 25,000 rupees for a conference. And second, best research faculty award. AAU will give this award to each university after identifying a best faculty who is doing really well in the research. Third one, best PhD thesis award and best publication award for the highest impact factor publication. Then best student of the university and the best sports person of the university. Okay, for all these, AAU will give awards and certificates. Okay, the modalities and what are all the regulations, details and all will reach you. I am requesting all the university vice chancellor take it seriously and make use of these schemes and the facilities. My dear friends, we are going to have a research journal. Yes, many organizations go for a journal. Why not the organization of 96 years should not have a journal? So that also brought out, it is going to be published in the near future. It is going to be International Research Journal, Research for Public Policy and Research. It is going to come at least 2 times in a year. It will be on the pipeline. Already we have framed everything. The first issue will be with you. And the next one, the renovation work. I don't know how many of you visited our AAU headquarters at Delhi. It's a very old building and requires a lot of attention renovation. With the initiative taken by Dr. Pankaj Mittal, adequate funding provision has been made. Now renovation work is going on. If COVID situation permits us, within another few months, you can see a totally different facelift of the AAU. All facilities will be there, both for your stay and for conducting conferences. And one more introduction we have made. What is that? Face-to-face interaction. After assuming charge as a president, I felt in the conference there should be one session, giving opportunity to the vice chancellors to listen the representatives and officials of the affected bodies and interact with them as well. That tradition was started and continued with the support of Dr. Pankaj Mittal and Dr. Mrs. Vani as well. They are regularly inviting and interaction is going on. And finally, my dear friends, it is an invitation to all the vice chancellors for a program, mega program of AAU, which is nothing but Dandi March. Probably all of you may be knowing about Dandi March. It was undertaken by the father of nation, Mahatma Gandhi, from Sabarmati Ashram to Dandi, as against the salt law promulgated by then Britishers. So it was held in the month of March. This is the year we celebrate 75th year of independence. And this program was already undertaken by our Honorable Prime Minister last year. And now AAU taken a decision to undertake one more Dandi March that was taken place in the as per the request of Mahatma Gandhi, led by Dr. Rajagopalacharya, then Governor General of India. He led the Dandi March from Tiruchirappalli, Tamil Nadu, and ended at the Vedaranyam of 160 kilometers. I have placed this request with the AAU. Why not? We can involve all the youngsters of the member universities, student friends, to participate in the Dandi March and let them take the credit of participating in the Chandi March. It is going to be held the April 2022, the 14th April 2022, exactly date in which Dr. Rajagopalacharya started the campaign as well. Communication will reach to all the universities in the next week. Please see that you will be debuting at least 2 students. Even faculty also can participate. By chance also can participate to walk for 160 kilometers. That is the major project which is going to, to commemorate 70th years of what you call as independence. Finally, my dear friends, my appeal to all of you. Number one, after my presentation, after Dr. Pankaj will make an elaborate presentation. After listening her, please speak. Please speak. What do you want from AAU? Number one. What do you want from other apex bodies? Number two. And you can prescribe, you can suggest some new programs also. Again, participate large in number in the rest of the conferences, especially the national conference, what we are going to have at Mysore, will be hosted by University of Mysore from March 23rd to March 25th. And last one, you should not take it otherwise. It is about the appeal to all of you, remit the subscription regularly and properly also. You know pretty well how much project we are undertaking. After listening Dr. Pankaj Mittal, you feel that is really a wonderful thing we are doing, not only to the member universities, but also higher education of India, even higher education of global level as well, for which we fully depend upon the sources from the member university in the form of subscription. My dear friends, you cannot believe, as per the statistics available in the financial statement, there is 7 crore rupees of outstanding of subscription from all the member universities. I am not telling all the universities. There are some universities, they have not paid their subscription for the last 7 years, 6 years, 3 years. So that made AAU take a decision in the last governing council meeting, send a final notice to the universities which have more than 3 years of subscription outstanding. If they are not paying within a month, their university name will be delisted. So no other go. We need funding, then only we can run all these programs successfully as well. So my dear Vice Chancellors, please check with your office, BC office, Registrar office. See that whether you have any outstanding arrear outstanding or current, please see that you will be remitting in time. And if at all any outstanding, that also if you make it, that will be a very big help to us. With these remarks, thank you very much for listening to me for more than 15 minutes. And I will appreciate if you extend your support as usual and with some other ways and means as well. Thank you very much indeed for the opportunity. Now I hand over the floor to Secretary General, Dr. Pankaj Mittal, please.
Thank you very much, sir. So this business session was to end at 12:30. It is 12:32, and most of the people from the next session have already joined. So, and because we have covered all the issues which I was to say in the presentation, so I think it won't be wise to make a presentation now in the interest of the time. Therefore, I'll be skipping the presentation, but only one thing which was mentioned to in the Governing Council, that in future we are thinking of having autonomous colleges also as associate members of AIU. So we wanted to have the opinion of the Vice Chancellors, whether you are with this idea or not, because then we'll be taking it up in our Governing Council, in our general body meeting in March. So rest, if any other Vice Chancellor wants to make a quick comment, we'll be welcoming that. But right now, I'm not in a position to make presentation because we have experts from UNICEF, we have experts from Niti Aayog and the Line Ministry who are already joined for the next session. So I don't want to encroach upon the time allotted for their session. So very quick comments from any of the Vice Chancellors. If they want to give any suggestions to AIU, you are welcome. Or if you feel that it is not possible to give your suggestions now, you can also give it to us in writing. You can write a mail either to the President AIU or the SDO office. So your suggestions will always be welcome.
So basically, hereafter the business sessions should not be like this. of giving minimum time. And this is the most important session in which we are able to discuss and listen to the Vice Chancellors. What I am suggesting, next conference onwards, it should be the first day of the conference, not the second day of the conference. And again, I am suggesting putting 5 speakers in a session. It is a really a tough time for the speakers and listeners as well. We can reduce the number, and the business session should be at least for 1 hour. Because after putting all these things on the heads of the Vice Chancellor and telling time is very short, if at all anything and all, it's not fair on the part of AAU to deal the Vice Chancellor and to deal the business session as well. So at least here, this session, we cannot do it. As correctly said by Dr. Pankaj Mittal, we should not make the dignitaries or experts to wait for a long time as well. And hereafter, we should not rush the business session. It should be very, very important session by which only we are going to interact with them. See, academic and all, research and all, fine. That we can have it with any other conferences. Meeting Vice Chancellor is a rare opportunity, I am telling. So at least in future, I am telling, it should be 1 hour session, and it should not be rush of putting somebody behind it as well. It is my opinion, madam. Hopefully, madam will accommodate in the future workshops or future seminars or conferences like that. Anyway,
Yes,
any Vice Chancellor is interested, sir? Any Vice Chancellor wants to say anything?
So at the very outset, in a very brief moment, I'll express our sincere gratitude. We've learned a lot from the Sustainable Development Goals, which have been discussed in the Central Zone and the East Zone conferences. We would just like a synopsis of the actions to be circulated amongst us, wherein we also have regional let's say, nodes which could take the responsibility of anchoring initiatives which are very commendably undertaken under the banner of the Association of Indian Universities, under your inspirational leadership and the visionary guidance provided by the Secretary General and the entire team of AIU. So our request is that, because once these meetings are over, the imperatives, the tangibles, the milestones, the timelines, if they could be elucidated, we would all benefit from it. Thank you very much, sir. And we've gained a lot during this 2 sessions, and our compliments go out to the distinguished speakers and also the eminent chairperson. Thank you. I'm Dr.
Thank you,
Grewal.
Dr. Grewal. What we are planning is, after all the conferences are over, we'll come out with a report. For every SDG, we'll be indicating that how the HEIs can contribute in realizing it, including what they can do on their campuses and what can be done by them by way of research or policy research, which can benefit the government also. And we'll also send a copy to the United Nations, who is collaborating with us in this conference. Sure.
Thank you very much, ma'am.
Thank you, Vice Chancellor, sir. Thank you.
Any other comment on the business session, please?
Yes, madam, please go ahead, madam.
Okay.
Okay. So it's again a privilege and honor for me to propose vote of thanks. I am extremely thankful to Dr. G. Tiruvasagam, President AIU and Vice Chancellor MH University, Chennai, for enlightening various new initiatives from AIU. I am also thankful to Dr. Pankaj Mittal, Secretary General AIU. Thanks to everyone. Now, because of shortage of time, I would like to invite Dr. Monica for the next session conduction. Over to you, ma'am.
Sir, should I start?
Yes, you can.
A very good afternoon to everyone, and welcome to the 4th technical session of SDG 6 on contribution of higher education institutions in sustainable management of water and sanitation in the Central Zone of Vice Chancellors Meet, organized by AIU in partnership with United Nations and hosted by Sri Vaishnav Vidyapit Vishwavidyalaya. In line with this, I would like to welcome and introduce the Chairperson, Dr. Alok Kumar Chakrawal, Vice Chancellor of Guru Ghasidas Vishwavidyalaya, a Central University of India. Sir is having more than 25 years of academic experience, including academic and administrative work. Sir has a special aptitude in management, commerce, marketing, finance, and research, and have gone to the countries like USA, UK, Thailand, and Nepal. Sir has promoted more than 100 researchers with 3 gold and 4 best research papers. Dr. Chakrawal is an experienced professor with a demonstrated history of working in the higher education industry, strong education, professional, skilled in educational technology, training, delivery, management, organizational development, and social media. A warm welcome to you, sir. Our first speaker of this session is Mr. Nicholas Osbert, Chief Water Sanitation Hygiene at UNICEF India. Sir comes from a background of architecture and engineering, having earned his degree in architecture with a specialization in urban development and his degree in water and sanitation engineering.
Monica ji, I would intervene for a moment. I understand Dr. Avinash Mishra from Niti Aayog, probably he is having short of time. Just look into that if there is some rescheduling of the panelist. If you look into that.
Professor Alok, you will be the one who will be inviting them. So you can invite him first.
Thank you.
She's just introducing.
Yeah.
Thank you. Thank you.
Okay. Sir has 20 years of experience in WASH and public health in Africa, Latin America, and Asia. Sir currently leads technical teams working in 15 states across India for WASH programming, notably to support the Swachh Bharat mission and Lal Jeevan mission. On behalf of AIU and SWV, we welcome you, sir. The next speaker for this session is Dr. Avinash Mishra, Advisor, Water and Land Resource Vertical, Niti Aayog. Sir is a General Civil Service Officer, presently working as Advisor in Tourism, Culture, Panchayati Raj, Water and Land, Niti Aayog, Government of India. He is having an experience of 29 years of working in various positions in Government of India. Dr. Mishra has been working in the national policy planning formulation, action plans of the country, and is engaged in the development plans, proposal of the state government relating to tourism, culture, and water resource sectors. Sir has also assisted to the plan panel of the country in the analysis of various projects in terms of socio-economic benefits and its impact, and has represented the Planning Commission, now Niti Aayog, in the various technical advisory committee. We welcome you, sir. The next speaker for this session is Mr. Samir Kumar, Joint Secretary, Department of Drinking Water and Sanitation. Mr. Kumar had also worked in different departments as a Deputy Director in Ministry of Commerce, Deputy Director in National Trust, Joint Director in Ministry of Expenditure, Deputy Secretary in Department of Economic Affairs, and Additional Economic Advisor in the Department of Commerce. On behalf of AIU and SWB, we welcome you, sir. The last speaker for this session is Professor D. Rajshekhar, Director, Institute of Social and Economic Change. He was a Hack Professor at the Center of Decentralization and Development at the Institute for Social and Economic Change, Bengaluru. Sir was a visiting scholar at the universities of Hitosh Subhashi, Oxford, Melbourne, Sussex, and at the Center for Development and Research, Copenhagen. Apart from that, Sir has worked extensively on decentralization, delivery of public services, social protection, microfinance, and local organizations. Sir has published 29 books, monographs, and over 100 papers in various journals as book chapters and working papers. For further proceedings, I would like to request today's chairperson to take over this session for the opening remarks, followed by the discussion. Over to you, sir.
Thank you, Dr. Monica, for giving such a vast introduction of all the speakers. And that was indeed needed to understand how, high-profile people are going to be part of this. My best regard to the President, Professor Dhruva Sagamji, Professor Dr. Pankaj Mittalji. I can see Professor Upinder Dharji and Dr. Alok Mishra, Dr. Ajay Singh. My best regard to all of the present people here. I may not be, taking everyone's name, so sorry for that. The first thing is that I must congratulate Association of Indian University and its entire team for organizing such a wonderful session on sustainable development goals. And of course, this water and sanitation is a very major area where these universities, I mean, Indian universities are going to play a very wonderful role in this entire process of, making this planet Earth a sustainable place to live in, and the kind of, place we are going to leave for our future generation. So, of course, SDG 4 is included in our national education policy and everywhere. And we are working and thriving for all 17 different, goals prescribed by United Nations. So, not taking much of time, because I understand there is a lot of paucity of time. So, I would request, I understand Dr. Avinash Mishra ji, who is the member Niti Aayog, is available right now online. And not taking much of time, I would request him to start his discussion as a panelist. Dr. Avinash Mishra ji, are you available here?
Yeah, thank you very
Yeah.
much. Thank you very much. Dr. Alok Chakrawal ji, and also Dr. Pankaj Mittal ji, and all the dignitaries who are here. Somehow I'll just scale through the way in which the water and sanitation aspect, that is the Sustainable Development Goal 6, is progressing in India, and what more is we are expecting from Indian higher education institution to really get involved in that. So I'll just start sharing my presentation, and with this presentation in a very disciplined manner, I'll proceed. Thank you. Thank you. Presentation. I hope my presentation is visible.
Visible,
Yes,
sir.
yes, it is visible.
Yes, yes, sir.
Thank you. Thank you. So basically, we'll start with the progress in water and sanitation sector and the role of higher education institutions in India. Now, actually, the SDG 6, which is the clean water and sanitation, everybody is available, and everybody is aware. We need to really ensure availability and sustainable management of water and sanitation for all. But if we see what the global scenario is and why we are looking this aspect so carefully, billions of people still lack access to safe drinking water, sanitation, and hygiene. In 2020, if we see the figure, then 2 billion people were lacking 26%. I am talking these numbers is the global numbers. And then 46% lack safe managed sanitation and 29% lack basic hygiene. Ensuring universal access and fundamental, which is very essential in COVID-19 recovery part 2. Now, actually, if we see, then 2.3 billion people live in water-stressed countries, and between 1970 to 2015, the natural wetland, those are already natural wetland, those were the source of the water, shrank by 35%. This is 3 times higher the loss of forest. But the loss of forest is being said more prominently rather than the loss of these wetlands. Now, as per the SDG 6, if we see the further parameters, sub-parameters, then universal and equitable access to safe drinking water, access to adequate and equitable sanitation and hygiene, improve water quality, and these aspects we are covering with our schemes, which I'll be stating afterward. Then increase water use efficiency across all sectors. We all know that in India, agriculture sector consumes around 88 to 89% of the water, and the efficiency there is 38%. Similarly, in transmission distribution losses in urban water supply, it is close to 45%, where 45% water we are actually wasting. So all these are the aspect. Implement integrated water resources management. Why the it should be based on the basin-based management rather than, so it should be integrated. Why we should think of 150 liter per capita per day water in the area which is near to Churu and where the lot of the scarcity of water is there. Protect and restore water-related ecosystem, and then international cooperation and capacity building support, strengthen the participation of local communities. These are all aspects what we need to do. But actually, if we see the performance of states in case of the water part, then quite substantial progress has been achieved. You will see there are achievers where we used, where we could really achieve 100%, and there are the front runner where 65.99% performance is there in case of the water aspect, water availability aspect and all. But performer are 50 to 64 and very less. These are the scaling on the basis of the SDG targets and achievements done by Niti Aayog. If we see, then Swachh Bharat Mission Gramin, because this is also part of that, then district verified as open defecation free is 100%. And the individual household latrines constructed against Swachh Bharat Mission Gramin, this is also 100%. Now, we see 95% schools have separate toilet facilities for girls, and 51.36% rural population receives safe and adequate drinking water through piped water supply. 97.44% rural population have access to improved source of drinking water. So this is the status of the sanitation part and the drinking water part. Now we see other SDG highlights. Then access to piped water supply, around 51% of the rural population receives safe and adequate drinking water within premises through the water supply. The aim is to increase it to 100% by 2024. As we know, the SDG target are to be achieved before 2030. So we are on the way. Access to improved surface sources of drinking water. Currently, 97.44% of the rural population in India has access to improved source of drinking water. And individual household toilets, all rural households have individual latrines through Swachh Bharat Mission Gramin, which was one of the flagship program of the government of India, which has remained. Now, SDG 6, the open defecation free districts, all districts in India have been verified to be open defecation free as of 2020. Schools with separate toilet facilities for girls, around 95% of schools in the country have separate toilet facilities, and the wastewater treatment, this part needs improvement. Only 1/3 of generated wastewater is treated in our country, that is 46.2 billion cubic meter out of 140 billion cubic meter what we generate. Only about 88.4% of industries comply with Central Pollution Control Board norms. So this is the lacking part which needs to be really addressed. Now, if we see the SDG highlights, then groundwater withdrawal against availability, stage of groundwater development in the country is 63%. In some states, the stage of groundwater development is more than 100%. That is Haryana, that is Delhi, that is also the Punjab and Rajasthan. So here it is too much. Percentage of block mandals out of the assessed block of 6965 assessment units, 11 and 14 have been categorized as overexploited. So the contribution of groundwater, if we see why the groundwater is so much being harnessed, then contribution of groundwater is 62% in irrigation, 35% in rural water supply, and 45% in urban water supply. Now, if we see the efficiency part, then we will see what is the productivity of the water. Then in UK, per meter cube of water fetches us $281. In Angola, 108. In Singapore, 85. In China, 16.7. But in India, it is 1.9. That shows our concern in terms of the efficiency of the water and the productivity part of the water. Are we really very much blessed with water? If going to that, then per capita water storage in India is 190 cubic meter. If we see in US, it is 5961 cubic meter, Australia 4717, Brazil it is 3388, and China is 2486. And one more aspect, it directly contributes to GDP. So any economic development is based on water. We need to really concern with the water part. Now if we see groundwater abstraction, then if we put China and US both put together, even it is less than what abstraction or what exploitation we are doing in India. So this is the situation of our water resources management part. If we see how actually we are doing with water, then virtual water export, which is in terms of rice, which in terms of other agriculture and other commodity, we are exporting a lot of water in terms of the crops and other water intensive industries to the outside countries, despite of being the low water country, still we are exporting. Now we see government of India schemes, those are there, and how we are going to achieve the Sustainable Development Goal 6. Then in 2019, we launched the Jal Jeevan Mission, and where it is to be provided the household tap connection by 2024. Estimated cost of the scheme was 3.6 lakh crore, 5.6 lakh crore household covered so far, and 10.25 crore to be covered. So with this, we are on the way. Jal Jeevan Mission Urban launched with a proposed outlay of 2.87 lakh crore. So we are seeing the urban part as well as the rural part. Swachh Bharat Mission, if we see, launched in 2014, aimed at construction of household-owned and community-owned toilet, and this mission could achieve its target by 2019. Now we are proceeding for Swachh Bharat Mission 2.0 plus and Amrit 2.0, where garbage-free, water secure, and untreated wastewater to be reused. That part and those activities are to be done. Now, as far as the efficiency improvement part is concerned, then Pradhan Mantri Krishi Sinchai Yojana is there, where actually the umbrella of so many schemes are there. Har Khet Ko Pani, per drop, more crop, watershed development, and irrigation, accelerated irrigation benefit program. Out of this, which we are going, and we are very sure to achieve all these benefits with efficiency improvement, and with that, we will be spending around 1 lakh crore in this by 2021 to 26. So this is what the government attention along with the funds to the water security and water efficiency part. Now, what happened? Actually, there is a lot of mass awareness is required. So Jal Shakti Abhiyan, which was launched in 2019, 1,592 blocks out of 2,836 blocks in 256 water state districts of the country. This was launched, where water conservation, rainwater harvesting, renovation, and traditional water bodies were actually repaired, renovated, and they were just treated just to increase the groundwater percolation and to create the storage. Seeing its good result again, in 2021, catch the rain where it falls and when it falls, it was done. So all these activities also the government of India is taking. Atal Bhujal Mission is one of the prominent, where the result for targets, we are moving ahead with that and recharging with the help of piezometers, how the groundwater gets recharged and how it behaves further. There is a treatment of wastewater. If we see the urban waste which we are generating, urban sewage load, that is 72,368 million liters per day. And out of that installed capacity, we have got 31841 million liters per day. And capacity which is getting utilized, it's 20,236 million liters per day. That shows that despite of, firstly, we don't have that much installed capacity. And whatever the installed capacity we have got, the sewerage is not reaching to the treatment places because of maybe the connection is not there, the sewer line has not been laid, and all these activities are happening. So this is again a focus area where we are concentrating how to go ahead. Now let us see what the role higher education institutes can play. As I have indicated you, what is the SDG 6, how the SDG 6 the government is doing, and what we expect from higher education institutions. So curriculum, as per the water conservation in National Education Policy 2020, curricular integration of essential subject and skills and capacity where water conservation is one of the part. So these subject skills and capacities should be learned by all students to become good, successful, innovative, adaptable, and productive human beings in today's rapidly changing world. Now, catalyzing quality academic research in all fields through new National Research Foundation, societal challenges that India needs to address today, such as access for all its citizens to clean drinking water and sanitation, the ability to conduct one's own research also enables a country to much more easily import and adapt relevant research from abroad. It is not only the engineers and scientists they will play, but social mobilizers, the economists, everybody need to play a role in case of the water conservation and transformation in the field of water. There are various disruptive technology, those are coming up that are expected to change the way of life and therefore change in the way educate students, include those relating to clean and renewable energy and water conservation. As I have already indicated that we are not yet using the wastewater. We are not yet using actually, we are not yet treating the wastewater. So that all is required. Role of higher education in implementation would be innovation in technology to make it affordable and accessible to everyone, cutting across the economic and geographic barriers. Then quality of human resources is required for nurturing competent implementers such as good leaders, decision makers, policy analysts, technologists, scientists, all that group is required. Education institutions can use the students' power to disseminate the message on underlying principles of SDG. As SDG already indicated, and we need to really work on automated leak detection and rectification system. These are challenges with us. Low-cost water treatment methods, smart water metering on Internet of Things based data analytics and decision support system, real-time prediction of irrigation requirement using artificial intelligence and machine language, then real-time water resources information system and sensitization activities. All these are required, which all these we want. There need to be the campus activities, Jal Shakti campus and Jal Shakti Gram. This one has been developed. We are water budgeting, field exploration, monitor water uses, and generating case studies. All may come up and can be there in case of the campus. The Mahatma Gandhi National Council of Rural Education has developed this curriculum, and I expect that this can be there. And finally, there is a call for global perspective. For the great minds or wise people, the whole world is a family. Thank you. Thank you very much.
Thank you, Dr. Mishra ji. It was really a wonderful and eye-opening session, and we understand that being part of Niti Aayog, you are having access to wonderful data of the efforts government is taking for the purpose of sustainability in water and sanitation. So I really appreciate your session. It was quite informative. And I understand this will go to the database of AIU. Not taking much of time, I would like to invite now Nicholas Osbert, who is chief of WASP project, which is Water Sanitation and Hygiene project of UNICEF. So I humbly invite Mr. Osbert, Mr. Nicholas Osbert, if you are there available.
Yes, I'm here. Good afternoon. I hope you can hear me well.
Yeah, well, thank you.
All right. Thank you so much, Honorable Chair. A few minutes to talk about these very interesting topics. First of all, thank you very much for this invitation. We are really happy and honored to be present to this high-level event. to participate. And thank you for the invitation. Just to introduce, the Sustainable Development Goals on drinking water and sanitation, it's around the safely managed concept. During the MDGs, it was improved water and sanitation, now it's safely managed. So what it means for water, it means available on premises, available when needed, and free of contamination. And for sanitation, it is, of course, access to a toilet and use it, and hand washing station, but we also look at the downstream part. What happens of the fecal material once it is in the toilet? Either it needs to be treated in situ, or it needs to be treated in a treatment plant. Otherwise, it gets released in the environment, and we miss the impact on public health. And this is the concept of safely managed. With this regard, India is a very special country for the Sustainable Development Goals 6.1 or 6.2. Why? Because it is the only country in the world that have such strategic and ambitious programs for water and sanitation. Nowhere in the world. I'm talking about the Swachh Bharat mission, now in the phase 2, and the Jal Jeevan mission. So, and India is really aiming at achieving the SDGs before 2030, like by 2024 and 2025. And this is very important. You know that the mandate of UNICEF, whom I represent today, is for children. And we all know the importance for the nation of water and sanitation to prevent the transmission of fecally transmitted diseases, also COVID-19. And this has a major impact on children, including on nutrition status of children. There is a lot of research and publication on this. So with this big agenda and very ambitious agenda in India, we strongly believe that the higher education institutions play a major role here. We are talking about 38.5 million students in India. Imagine the scale. This is almost the size of my country. And also, it's the third largest in the world in terms of budget. And so the students are really the future, and this investment is hence very much welcome. We, as UNICEF and other UN agencies, we have very great and operational partnership with academic institutions on water, sanitation, hygiene, and public health initiatives. Few of them that I want to mention here, the one with IIM Indore on doing some evaluation on the sustainability of the open defecation free status under the Swachh Bharat mission. More recently, we have a great partnership with Dibrugarh University in Assam. This is to implement a master's on health, sanitation, and hygiene, and also to build the capacity on monitoring water supply initiatives. In Gujarat, we're working with IIT Gandhinagar on research on the presence of coronavirus in water sources, and also now working on a climate risk analysis to inform policies on water sanitation. Let's not forget that India is unfortunately the 7th most vulnerable country with regard to climate changes. Hence the importance again on this drive for SDGs, because this is the only way to help communities what they are facing nowadays, droughts and risk of floods. I found the previous presentation very informative in this regard. India extracts more groundwater than China and the USA combined. This cannot be sustained. We are working as well with the National Environment Engineering Research Institute on what to strengthen the capacity of water quality testing labs. And we are a large-scale partnership with Tata Institute for Social Sciences. And I appreciated the previous session where we talk about social sciences and behavior change. Water and sanitation, although I'm an engineer myself, it's not just hardware. It's a lot about software, behavior change. And this is why we have this partnership with TIS. So there are many others, and we want to continue that. We see a great value here for evidence generation, to engage students in operational activities in the field, and also to continue to develop the expertise in India. India is not just a player for India. India is a global player in water and sanitation. And there are lots of bilateral collaboration, and I hear we'll hear from the next speaker as well on the important role played by India on the global dialogue on SDG, on water and sanitation. The few challenges I would like to flag here on mobilizing students, we have, number one, we have like perhaps around 4.7 million students enrolled in Bachelor of Science. However, we don't see that they become scientists, researchers, and managers as much as it could. So how to better prepare this workforce to give them opportunities? And that's a point we could discuss. Perhaps a bit more effort on providing access to higher education to people with disabilities. And we see that less than 100,000 are enrolled in 2020, and perhaps we could do more here, and India could lead by example here. So on this issue of people trained not accessing to perhaps the right jobs at the right level, perhaps look more into vocational training as a path to professionalization. We see, for instance, that there are many private coaching centers for engineers and government aspirants. But then beyond the hardware, could we have a bit more on opportunities, because there are big demands in India on issues related to public health and behavior change science, which are equally important. And I think in this sense, the national education policy from 2020 it's a good framework, because it really promotes a multidisciplinary approach to higher education going forward, allowing undergraduate students to engage in other topics and address the emerging issues that are faced in India and in the world, and to pursue skilling courses beyond the university curriculum. Indeed, in India itself, there is a huge need of trained workforce, for instance, on hygiene and sanitation. UNICEF, we conducted an impact assessment of the Swachh Bharat mission, and we could demonstrate that during the first phase, between 2014 and 2019, this program alone generated 7.5 million full-time equivalent jobs. That is, and there is another study from the India Sanitation Coalition showing that the sanitation market in India alone is in the range of $30 to $60 billion. So imagine the opportunity here in terms of livelihood. And we don't have the studies yet for the Jal Jeevan mission, but we anticipate that there is a great opportunity here. And there are big needs in the 3,000 urban centers, 650,000 villages. From our data, there is a need of at least 2,000 professionals to work at the district level to manage systems and programs. And overall, more at the grassroots level, there is a gap of around 1 million sanitation workers to be equipped and to perform. Also, a lot of opportunities brought by the aspiration of India to be part of the green economy. This is also linked to the SDGs. And so we heard, about the recovery of the COVID-19 pandemic, that it has to be a green one. So here, perhaps we need to shift and create more opportunities and vocational opportunities for the youth interested by the youth economy. And this is directly linked to the SDG 6 on water and sanitation, but it's much broader than that. It's about the environment. It's about SDG number 4 on quality education, number 5 on gender equality, on SDG 8, decent work and economic growth, and so on and so forth. So it's much broader than just water and sanitation. And to finish, I have 3 suggestions and recommendations moving forward. So number 1, it's perhaps support diversification and trying to promote more multidisciplinary pursuits, because these are the needs in India and globally. And hence, in the same way, number 2, provide more soft skilling training. Scientific content is important, but as a professional, you really need to learn about management, communication, leadership, and perhaps broaden a bit the scope to prepare the future workforce to play their role. And the last one, there are emerging issues and in the curriculum, and this is happening somehow, but more is perhaps required on building the capacities of teachers, professors to address the emerging challenges, particularly the water scarcity issues. And again, the previous presentation was showing very critical figures. To strengthen resilience to climate changes, this is there. There are cities that will go underwater. There are cities that will not have any water, and the situation in 250 districts with regard to droughts is quite dramatic. And there is much more that can be done here. And finally, UNICEF and all the other UN agencies are accountable for partnership and support and the work from academic institutions. I have shown you the type of partnership we have, and we could do more. So reach out to our teams in Delhi, reach out to the field teams. We'll be very happy to explore opportunities of partnerships with the academic sector. Thank you so much.
Thank you very much, Mr. Nicholas. I'm really impressed the way you presented India's data and effort in terms of attaining sustainable development goals. And I'm really impressed that you are confident that we will be attaining the goals ahead of the deadline, that is 2030. So that is one thing very wonderful. And I'm thankful that you noticed about our Swachh Bharat mission and Jal Jeevan mission, because we have been pursuing this Swachh Bharat mission for the last 7 years, and there has been drastic improvement in terms of cleanliness and contributing towards the sustainable development. I'm sure you must have gone through National Education Policy 2020, and that's what you mentioned here. I'm not only sure, but I'm confident, and I've gone through the NEP 2020. So SDG number 4 has completely been addressed by our National Education Policy 2020. Your suggestions have been well taken in terms of multidisciplinary approach and soft skill training, and the role of teachers and professors in terms of spreading the idea of sustainable development and efforts regarding that. So thank you very much for your wonderful contribution. Now I would like to invite Mr. Shamir Kumarji, who is Joint Secretary with the Department of Drinking Water and Sanitation, Government of India. Samirji, I can see you here, and not taking much of your time, I would really request you to please proceed with your wonderful thoughts and ideas in terms of SDG number 6.
Thank you, Professor Alok, and very good afternoon to all of you. I have a short presentation, and I would be speaking about my ministry, the department, which is handling both the flagship program. That one is Swachh Bharat Abhiyan, now phase 2, and the Jal Jeevan mission. So I just go through. I have a general presentation, some slides on general nature, and then I will go specifically to the JJM, because I think you all will be very interested in having that. It is a very big program, and it's going to be a game changer if we succeed in its objectives. So I'm going directly to the slides. Just allow me. Can you see the slides?
Sir, we can see it. We can see it, sir. Please proceed.
Now we are talking about the contribution as of HEI, is the sustainable management of the WAS, basically SDG 6, the goal. And our vision 2024, that is 2 things, which for both our flagship program. One is functional household tap water connection to household under the Jal Jeevan mission, and second one is now the phase 2, solid and liquid waste management in the villages. And in this department, we only concerned with the rural areas, and the urban part is taken care by the MAHUA, that is urban areas and housing ministry. Now progress as on date is so far household covered are 8.83 crore. And this is the total target of this is around 19.25 crore is the total household in India. And so far we have reached 8.83 crore as on date. That is 45.92%. under the Jal Jeevan Mission. So we have been able to provide them the tap water connections. Then in village declared as ODF also, there is a 33,000 villages who have declared themselves as a ODF plus. ODF plus, I will come and explain that concept later. What we believe that what is going to be the contribution we expect from the HEI education institution, higher education institute, to develop a skilled workforce for the wars, support, develop strategy for behavior change, very important for both the program. And when I go into the details, I will explain that why. Then, of course, undertake research and development for the war sector, which is sometimes is very challenging and is sometimes very technical also, which we are facing in SBM phase 2. Then fourth is support the monitoring and implementation of the program, equally very important. And of course, just see the how we can do further and act as excellence. Then priority areas of our collaborations, what we believe is support our national water quality monitoring efforts, skilling the workforce for SLWM, very important at the rural areas, communication and social mobilization strategies for the WAS, then knowledge coordination and management, and of course R&D, particularly in the plastic waste and the fecal sludge management, which sometimes, because we generally prefer very low cost of things, local solutions, so it's very challenging sometimes to have come up with the local solutions for fecal sludge management, and of course the plastic waste management also. Now I'm coming into the detail of the Jal Jeevan Mission. And as you know, all my colleagues, both Nicholas and Avinash Mishra sir has also already explained, the objective of the program, which was announced on 15th of August 2009 by the Honorable Prime Minister, every household would have a functional household tap water connection. Functional is very important. Generally, why we are putting stress, we need to see that there is a tap water and there is a tap, and the water is flowing through that. That's has to be functional. So our whole stress of the program is on this particular word, functional. And we propose to have assured tap water supply in adequate quantity with pressure of prescribed quality and on long-term basis. So whole model of creating an infrastructure, water infrastructure in the rural areas, in the villages, based on these objectives. To have our adequate quantity, source sustainability need to be there, pressure of prescribed quality of the water, and of course it has to be long-term basis. So it's quite challenging, and but we are working on that. And of course, when we started, there were 3.23 crores of the households which were being provided with the tap water connection. Now we have had a target of 16 crores. So far, the government is also very supporting on this, because the way it has committed the amount for this program, that is huge, 3.60 lakh crore in next 5 years. So it's a huge financial commitment by the given, and with the 15th Finance Commission grant also available there. So it is going to be a big, money-wise, it is going to be a very well-supported program, which we have seen in phase 1 of the Swachh Bharat also. Unless until we put the money there, sometimes the program will not succeed. So it was also important the government shows our commitment by providing adequate budgetary resources at the disposal, so that the things can be done or implemented on the ground. And of course, we started implementation by release of the operational guidelines, which is a very delayed, but if you have it is also hosted on our website also, very detailed one. And this was launched on 25th December 2019. And of course, what is the expected outcome, which is really is reduction in drudgery of the women and girls. If you see in the go to the countryside, half of their time is wasted in fetching the water or arranging the water. So you might have seen in desert area, you might have seen in the hilly areas. So these are going to be a game changer particularly for the women and the girls. And of course, in the improvement in the quality of life, which is the objective of the government, enhancing of the ease of the living, and providing dignity of life to the rural community, which is very important. We feel that dignity of life is very important. So all these factors really count there. And of course, these are the institutional framework which we call it at national level. There is a National Jal Jeevan Mission. At the state level, there is a State Water and Sanitation Mission, which is headed by Chief Secretary, which plan the state action plan. District level, the district collector head this district water and sanitation missions. And of course, in village level also Gram Panchayat, which is I would believe is the most important and critical component of whole program, because they are the persons who are managing these things. So there is a village water and sanitation committee, which is sometimes in some areas also called Pani Samiti. And of course, there is adequate presentation of the weaker societies, the women, and they are also being trained for handling some like field testing kits and all those things. So these are the some of the objectives which we have in this program. And what is the new about this program is we have a National Rural Drinking Water program also, which are running for quite a long time, and RDWP. But we changed subsequently into Jal Jeevan Mission. And what was the change paradigm shift which we see? It is a tap water connection to each household. It is going into the each household. It is not that we have kept tap water 50 meters away and we say all these household or the habitation has been covered. So this is not there has been change in the definition. Now we are providing the water inside the household. Then second, of course, is providing all the tap water connection to all public institutions like school, Anganwadi, Ashram Shala, health center. So we are going into this in mission mode. And as of now, I think more than 70% of these institutions have been provided tap water connections. And of course, there is a central role for women and weaker section in managing the in-village water supply. Water quality affected area has been prioritized. Many areas of our country like Rajasthan, Bihar, West Bengal, they are suffering from water quality issues like arsenic and fluoride. So that is being prioritized. It is not that it was not earlier prioritized, but it is now being tackled much more in detail. Of course, the unit of coverage has changed from habitation, where we put one tap water connection there, and we used to define that habitation is covered. Now it is the household. And of course, service delivery has also, we have become much more ambitious. Earlier, there was a 40 LPCD, that 40 liter per capita head. So now it has increased to 55 LPCD. So we have become much more ambitious there. And of course, community ownership, which is very important for both our program, the Jal Jeevan Mission and Swachh Bharat Mission. We have seen in Swachh Bharat Mission how the things has done because of the community participation. So from the day one, our stress from the Honorable Prime Minister was for people participation. And we succeeded in phase one because I was associated from the beginning. So I can tell you from my own personal experience, it was really a big game changer, at least in the implementation of any program, and particularly in the presentation how the community is owning the asset which are being created for them. It's very important when you go to the villages, government create an asset, but sometimes it is not being properly owned or maybe taken care by the villagers, so it goes into the disuse. So it's very important that the local people consider themselves is to be their own community, their own assets, and they accordingly take care of that. So it's very important in Jal Jeevan Mission also, the asset which would be created has to be managed properly. So there has to be some community ownership we can sue. And the phase two also, which is basically solid and waste management, where it's very equally important that the community come forward, the villagers come forward and take care of the asset which is being created. And of course, we are also running a special campaign for installing portable tap water and end-to-end approach, like from the beginning to the end, all the dovetailing of resources, strengthening of the resources, grey water treatment. We believe that after Jal Jeevan Mission, since the more water is flowing into the household, so more grey water would be created. So we are going for that type of treatment also. And I can tell you right now, the figure is around 13,600. 3 villages, they have said and declared themselves that they have some site of grey water management. So things are increasing there also. And of course, functionality is very important, as I already mentioned earlier. And Gram Panchayat and the subcommittee has to perform the role of the public this is a very important that they take care of the things, because unless until it is locally managed, it would not succeed. So these are the things. And of course, community contribution, again, a very important component of the whole program. 10% of the community contribution would be there, which can be in the cash or in the kind. They can provide you the labor. Why we are putting this 10% component? Reason being they should know, because if we give many things free, then people don't appreciate the value of that. So that's why it's a very small amount, and where we have seen that some people are paying, that has succeeded. That has succeeded in door-to-door garbage collection also. If you are paying some amount, then things functions. So that is also going to be the case in Jal Jeevan Mission. And there are so many support activity under the Jal Jeevan, like spread awareness and sensitize community on judicious use of the water, community contribution and the ownership, and build capacity of the Gram Panchayat, setting up the long-term sustainable institution mechanism, build skills of the various human resources, equally important. We have seen in Swachh Bharat Abhiyan, the toilet which was constructed, we created an army of the missions. And we created a particularly an army of the women mission, which we have seen in case of Jharkhand, in Odisha also, which we used to proudly call them Rani Mistri. And they skilled themselves and come up with the construction of the toilets. So it's very important. We train them under the skill development schemes also. All the masons, plumbers, electric, motor mechanics, plumb operators. The way the training would be done and the employment opportunity which will be created because of this is going to be a huge impact on the rural economy also. And of course, developing responsible and responsive leadership within the ground community so that they work, the things work there. And of course, in capacity building portion, which is also important in implementation of the successful implementation of the program, is setting up the knowledge center or center of excellence, change management, like providing annual training to all the engineer cadre people. Then emphasis on service delivery. It is now shifting from infrastructure building to the utility approach. Again, government utility approach, just working like somebody which is going to provide you services. So this utility approach is very important. And of course, training of the PRI members, the committee members, then training of the water quality surveillance, like we are preferring the 5 women from each household to be trained for free testing kit and sanitary inspections. So it's very important, and many already training has started. And of course, skilling of all the masons and plumbers, as I have mentioned earlier. Now to have the knowledge center, I'm coming back to the role of the higher education institutions and how they can do that. To have wider consultation with all of them for the Jal Jeevan Mission and PM with the academic institution, establishment of a JGM professor chair, and maybe 5-year duration, some period need to be there. And these chairs would undertake activities like capacity building, training, research, education, outreach in their respective area. And of course, their chair has already been set up in 5 different focus areas in 5 eminent institutions. These are the eminent institutions, 5 institutions where focus area has been given, like IIM Bengaluru, utility development and water economics, IIT Jodhpur, sustainability of the drinking water sources, IIT Guwahati, water treatment technology, is decentralized governance for water and sanitation services, and of IIT Kanpur, IIT and data science for the service delivery. And so we have also identified Center of Excellence. There are 2 host institutions, Indian Institute of Technology, Chennai, and Institute of IIT, Gandhinagar. You know, who could become a key resource centers like university, deemed university, administrative management, engineering institutions, national NGOs, CBOs, or training institutions or institutes of higher learning. All these are qualified to become a key resource center for us. And of course, the design already, I'm not going into the details. I believe that we will be sharing the PPT also, so which can be a part of that. And of course, these are some areas for senior management. We believe that planning, policy and regulations, utility reforms, financial management, which is at the top level. And the middle level, we have a planning and ecosystem building for the reforms, project management and financial management, and of course, very important, water quality. And at the ground level, of course, water and planning, project management, O&M, and macro level leadership and providing skills, all those things. So some, I can share that some institutions have been impaneled are level 1, level 2, which you could see in the list. There are like All India Institute of Local Self-Management, Mumbai, Engineering Staff College of India, Hyderabad. All these institutions have been identified as a level 1, level 2. That's all from me. And from the Swachh Bharat Abhiyan phase 2, I could mention that we have already 4 or 5 verticals which is really technical in nature, like plastic waste, solid liquid waste management, fecal sludge management, grey water management, and also there is a Govardhan, which is also for organic waste, management of the organic waste. So these are the 5 verticals we have, and all verticals are challenging for us. And of course, we also mentioned about a couple of things about what we have done, how we monitored the scheme, how we succeeded in phase 1, which we believe is a robust MIS. And it was very modern. I have a database of all the household in the country, rural household in the country. And we used to monitor, and we used to go east to the district, to the village, to the particular household to see whether toilet has been built for him or not. That type of information we used to have on the real-time basis, and thanks to all the data entry operator and the local level functionary, which really helped us and really make it a people's party, people's movement, as Prime Minister used to say. And the Swachhta Gadi, which was named like the foot soldier of the sanitation there, which you might have also seen on the ground, which used to go forward with the message and do the monitoring and all those things. So we have a very robust MIS, which we used to monitor like anything to the implementers, which is now, right now we are also doing for the JJM. And of course, the foot soldiers, which is already on the ground. So these are the 2 people crucially, which made all the difference. And I can believe, I can tell you, like just like in MDG, unless we do well, the India do well, we would not be, the UN would not be able to manage this, fulfill this SDG 6. So we believe that 2030 is the target, but 2024-25, we would be able to have a good, robust sanitation practices at our level, the sustainable part, and providing the potable water, drinking water to all. And of course, we also handled in 2019 Jal Shakti Abhiyan 1, which was basically creating more awareness on water conservation. And it was also mentioned in one of the presentations. So we also did that, and now it has gone to Department of Water Resources for phase 2, because they are the more appropriate ministry for that. So Jal Shakti Abhiyan also we believed, and we did a lot of work there, and we really managed to create an awareness at the ground level also. And here also the Mukhia or the village head, they were the most pivotal. So we have given them, we have put all the confidence in them, and they are delivering. So these are the some factors which really made this program successful. That's all from me. Thank you.
Thank you, Samirji. It's a really eye-opening presentation from your side. And of course, we had been coming across this ambitious project of Honorable Prime Minister Sri Narendra Modi ji, which was announced almost 2.5 years back. And you have an ambitious target of, fulfilling it by 2024. And as I understand, Indian houses are categorized into 3 categories. That is, 1 permanent, 2nd is semi-permanent, and the 3rd one is temporary. I understand your target is permanent houses, but that too, ranges in millions of houses in India. India is probably having the largest number of houses in the country. So the way you explained the government's efforts in Swachh Bharat Abhiyan and Rashtriya Jal Jeevan Mission and all that, that's really an eye-opener, and I'm sure that this is going to be part of wonderful document which will be in future course of time presented by the AIU. We are having paucity of time, but your presentation was really quite informative and interesting. So I thought let it go through the full length. And now I would not taking much of time. And I immediately invite Professor D. Rajshekharan ji, who is Director of Institute of Social and Economic Change, to share his ideas and views on SDG number 6. Professor D. Rajshekhar ji.
Thank you very much, the chairman, and then I also thank the organizers for giving this opportunity. And I would like to share my PPT. Can I do that, sir?
Yeah, Samirji, you are sharing your PPT. Please
Yes.
unshare it so that Professor Rajshekhar can share. Yeah, please proceed.
Yeah. I do hope that you are able to see the PPT, sir.
Yes, sir, we can see it very well. Please
Yeah,
proceed.
Okay. Sir, I am from, I'm director of Institute for Social and Economic Change. This is a research institute, and then a institute which also undertakes training and then provides PhD training. And then we have quite few research areas, and then of them important one is rural development. And then I would like to say that we come into the picture as far as this achievement of this goal is concerned, that providing research inputs. And then with regard to the status of realization of this goal, SDG 6, the previous speakers have already mentioned about the status. And then, so I don't want to dwell so much on that. And then what I would like to do is that I will focus on sanitation. And then the reason why I'm doing is that the previous speakers as well as government documents say that 100% all the villages or all the districts have declared as open defecation free. And then, so this is something which I think this issue needs to be looked into. And then the basic material for my presentation comes from two large studies that our institute has undertaken. Both of them are funded by the Karnataka government, and the reports are also approved them. And then with regard to access to individual sanitation, there are several hits, as previous speakers have mentioned, but there are also misses. And then what we found is that after Honorable Prime Minister Narendra Modi ji has introduced the Swachh Bharat mission, and then this call of Swachh Bharat mission has really improved the access to individual toilets, and then so much so that by 2019, Karnataka government declared that all the Gram Panchayats are open defecation free. But the study results that what we have carried out, and this is a large study carried out in 5 representative districts, and then from 60 villages, and it shows that, and the proportion of the households having access to sanitation, that's individual sanitation, is only 71%. So then there is also considerable variation across the districts and
Professor Rajshekhar ji, I would request you, Professor Rajshekhar ji, your slide is not moving.
Okay. Can I? Is it moving, sir? Now
it is visible, but it's not moving.
Okay, I will stop share and then
you can tap
share.
next.
I'll share once again.
Yes, sir, your slide is, we can see, but it's not proceeding.
Yeah, I don't know. I am able to move. Okay, this.
You have to do it in a slideshow mode.
Yeah, that's what I have done. Slideshow mode. And then how about now?
Now it should move. Not moving.
Not moving. Oh, that's quite.
I think, sir, you are sharing a different window. Actually, your slideshow is running in a different window, and you are sharing another window.
Okay.
Yeah, now it is moving.
Now it is moving, sir.
Yeah, it's moving.
Okay. So then, yeah, and then so now we are able to see, isn't it? Okay.
Yeah, we are able to see it, sir. You proceed, please.
Yeah. So what I was telling is that there is considerable variation across the districts and social groups, and then you can see here that there are some districts which are quite developed. The access is as much very close to 100%, but there is also a district which is very poor and backward, and which is located in northern Karnataka region, which is very famous for, it's called Kalaburgi. And here only 35% of the households were found to be having access to individual toilets. So there is a considerable variation. And then if you look at across the caste groups, and then the access is somewhat higher among minorities and other backward castes, but it's somewhat quite low in the case of scheduled caste households. So there is this kind of variation is there. And then the reason why some of the households are not having individual toilets is that the high cost of construction, because what they basically imply that the kind of benefit that is financial incentive that is provided by the government, it's not sufficient for the poor people. The second important reason is that lack of space. Now, it's most of them have stated that they don't have space, so therefore they could not go for individual toilet. And then the other thing is that valuing toilet. So I mentioned that 71% of the households currently have access to individual toilet. And this year, United Nations has declared World Toilet Day. And then I think important message that was given is valuing toilet. This implies that when the access to individual toilet is enabled or provided, whether households are expected to value them by way of regular use. But then what we found that 92% of the households who gained access to individual toilet under the Swachh Bharat mission, they were not only 92% were using, the remaining 88% were not using. For the following reasons, actually, this is basically, it all depends on whether the use of toilet depended on whether self-funded or government-funded. The self-funded toilets tended to be better in terms of the construction, floor, roof, door, and so on and so forth. And then because of limited money that's given by the government, the quality of the toilet was somewhat poorer. So this is one of the factors which restricted the access to toilets. The second one is also distance. Distance is most of the households have gone for toilets which are located, which are distantly located because they did not want to have toilets within the household and within the house. So because of purity considerations or whatever other reasons. And this in a way came in the way of regular use because they could not use it in the night time or and so on and so forth. So these are the two important reasons why the toilet use was in a way adversely affected. So based on this, as a research institute, and we have provided suggestions, I think our key message to the government as well as to those who are listening here is that the behavioral change is very important, and then the kind of strategies that are adopted to get behavioral change, I think there is a need to change them. I think the first message that I would like to give as a part of this institute is that our institute's work, one size fits all approach does not work in the provision of awareness on sanitation and awareness, because the strategies have to be situation specific. What I mean to say is that, and all over India, the same kind of strategies are being adopted. So what we suggested to the government is that, thinking is that in those localities where the toilet use culture is very, very well advanced, SBM plus kind of strategies have to be adopted. And then in the case of those places, those localities, where households have recently gained access to toilets, I think the awareness or behavioral change should be how to use them regularly. This should be the important component. The third component is that where the access to toilet is very, very low, like some of the poorer districts and poorer areas, I think here the knowledge should be it is on the very basic thing of sanitation, hygiene, wash, the entire this thing. So I think even higher education institutions, when they focus on behavioral change, I think strategies will have to be quite different across the different localities, and the same type of awareness, same type of behavioral change strategies will not work. The second important thing is the democratization, the provision of awareness. What seems to be happening is that awareness provision is usually top-down. It's basically the government machinery which seeks to provide. And then there are people's institutions and then Panchayat Raj institutions, and then they should they should play a central role when it comes to the providing of awareness. And then while motivating the households, I think what seems to be happening is that the households are threatened. If you don't go for toilet, then the future benefits will not come from the government. I think this kind of threats have also made the people to just go for toilet, construct the toilet for sake of constructing, and without really bothering so much about the quality and other things, just to fulfill the targets. I think the higher education institutions, when they go for behavioral change or whatever it is, and then I think they need to have some kind of different kind of approach on behavioral change and awareness. The other important thing is that increase in incentive amount. The current levels of finance are inadequate. And then because what seems to be happening is that with the small amount that is available, they are not able to have quality construction. And this is coming in the way of sustainable use. And then the other thing is that the toilets are also not used due to pursued beliefs that the problem of water inadequacy. So hence the higher education institutions should provide more emphasis on behavioral change through awareness and education, the provision of rainwater harvesting, or some ways in which water could be saved. And then these two objectives need to be combined. So our as a research institute, what we normally do is that we conduct seminars or webinars, and then on toilets on the eve of World Toilet Day, then we have conducted a webinar to provide general awareness about, or provide disseminate the findings from our research studies. And then this was also covered both in local as well as English media. And then we also bring out policy briefs like this. What we can see that our institute brings out policy briefs so that the policy makers are aware of the issues that are involved in this sustainable management of water and sanitation, and then they formulate appropriate policies and programs so that we can achieve the target, that sustainable development goal of 6 by 2030. And then this is in short what we have been doing in our institute by way of achieving this goal. So this is where I would like to stop, sir, and then over to you.
Thank you, Professor Rajshekhar ji, and I'm really impressed by the research you have carried out in terms of water and sanitation. This has been really a great contribution. I can see all 4 speakers and panelists, Dr. Avinash Mishra ji, Mr. Nicholas Osbert, Mr. Samir Kumar ji, and Dr. Rajshekhar ji. I mean, this session has been really quite eye-opening and a tremendous, bunch of knowledge we have received. I appreciate the efforts of AIU, Dr. Pankaj Mittal ji, Dr. Rama Pani ji, who has been constantly following me for this session, and I feel a kind of privilege that AIU thought to invite me as the chair of this session, because I have been benefited intellectually in a tremendous manner, and I'm overwhelmed by the way you people are organizing such a wonderful events. I'm thankful to the president of AIU also, and now over to Monica for further proceeding of the session. Dr. Monica.
Yes, sir. Thank you so much, sir. On behalf of AIU and SVVV, I am thankful to all the speakers of the session for their valuable insights and words of wisdom. I would like to thank Chairperson for the smooth conduction of session for achieving the objectives of SDG 6. Last but not the least, I would like to thank the respected Vice Chancellors, other seniors and academicians and other participants for sparing their valuable time to make this session successful. Thank you so much, sir. Thank you, everyone. Now I request everybody to join the valedictory session. Over to Rupali ma'am.
I think we have 5 minutes to go. Honorable Minister of Health, Madhya Pradesh will be joining. So we can have a comfort break for 5 minutes.
Okay.
Are you giving any refreshment, Vice Chancellor, sir?
Virtually, but I cannot reach
Sir, I think in this blended world of learning and exchanging ideas, soon we will be having such kind of arrangements, and I'm sure Dr. Pankaj Mittal will take an initiative to deliver refreshments in such kind of virtual breaks.
You know what is happening now is that people are ordering something like pizza, where the branches are there all over the country, and they are telling that deliver pizza at this address on this time. So then everybody eats together during the virtual meeting.
Ma'am, I'm taking green tea on your behalf.
Thank you. Thank you.
I think it is sponsored by AIU.
Thank you. I was about to tell Professor Thiruvasagam sir that since morning, Professor Dhar has made us sit throughout. So even a welcome break of 5 minutes is most welcome.
Now, what I am suggesting, University BBB, you can think about whatever suggested by Dr. Pankaj Mittal. You can do it tomorrow, sir. No problem.
Yeah.
Communicate all your residential address. No meaning.
By the way, Chairman sir, I would appreciate Dr. Pankaj Mittal's idea to make these autonomous colleges as associates, because ultimately NEP 2020 talks about giving more autonomy and converting this autonomous colleges as universities also. So sooner we'll be having bigger number of universities, so they are budding universities, and you can think of associating. This is from my side. I mean, this is my personal view. Maybe others having a different view on this.
Over the time, that is by 2035, there won't be any affiliated colleges. So
Yes.
they won't be affiliated to any university. So most of them, many of them will become autonomous. Therefore, it's a good idea to...
So, Sir Alok Chakrawal, this decision has been already taken in principle in the Governing Council meeting.
Oh, wonderful.
We are going to get it legalized, placing in the ensuing general body meeting, because it requires some change in our constitution as well. So far, we have not entertained any colleges of standard any level, and it is going to happen.
Oh, great. That's a great initiative.
All initiative made by my Secretary General, Dr. Pankaj Mittal only, sir. Supporting her, that's all.
Sir gives so many new ideas. So in this 1 year, we have taken so many ideas from him, including the payment of subscription fee, which was pending for a long time.
Okay.
By the way, I must appreciate your flagship magazine, University News. It is also doing wonderful job, and the entire team behind it. So
Yes.
you also you deserve congratulations for, because it has set a benchmark. I mean, no magazine has come up to the University News level till date. So that is also one thing I wanted to add here in my observations.
Yes, Dr. Rama is doing a wonderful work in editing University News week after week, without
thank
any
you.
break at all, despite COVID.
Oh, great. Dr. Rama, you deserve a congratulation.
Thank you. Thank you,
Was
sir.
successfully transferred from hard copy to the soft copy.
Yes.
Most of the vice chancellor, even academicians, when they want to go for a meeting or prepare an article, they collect details from this AU news only.
Sir, Guru Ghasidas Vishwavidyalaya will contribute certainly.
Okay, that's great.
Sir, we look forward, sir.
Likewise, he's going to bring the journal also, sir, research journal.
Oh, great. That's a wonderful initiative.
And public policy as well.
Okay.
Only thing is, we are not able to support AIU, especially Dr. Pankaj Mittal, by giving more manpower, sir. You may not be knowing, only 40 people are working there, but whereas the workload is for almost more
No,
than
manpower is the basic need, sir. I mean, you can think of, having different categories of manpower. I mean, you can think of outsourcing certain things. Like AICT has a wonderful, mechanism of outsourcing its responsibilities. They work as good as part of AICT, what I have seen. So you can, talk to Anil Sashmutteji also. So some mechanism you can think of, implementing, where you can have more number of people who are supporting AIU's activities. And of course, dues, what you told, that 7 crore rupees, that's a good amount. I mean, big chunk of money you can think of, realizing all this and motivating members to pay their subscription and membership fee in time. So that is also one thing we can think of, generating more resources for AIU. Being a man of finance, this is my concern, that finance is the basic thing which is needed for any organization to run smoothly and effectively. So to put your impact more emphatic way, you need to have a lot of funding.
Yes.
So we can think of philanthropic approach also. That may be one of the way you can collect, because there are people and generous people who can be very supportive to this institution.
We will speak to you. We find generosity in you also.
Sure, I'll be happy to.
Thank you. So we can start. I think it is 2 o'clock.
Yeah, Honorable Minister is about to join.
Okay, so you want us to wait for him?
Yeah, I think 2-3 minutes we can wait.
Okay, okay.
About to join.
Sir, already joined.
Achha, is he already there?
Yeah, already he joined, his office joined half an hour before. He was
Okay. If he's already there, then
This is already joined.
Sarang Sahab, aap hai kya? Sarang Sahab, आपने join किया है?
No, sir, he is not joined yet.
Yeah, not yet. I have spoken to his Yeah, he says that he's on way. He had a meeting with Chief Minister. So within 5 minutes, he'll be joining. So should we wait?
5 minutes.
Yeah, he had a meeting with the Chief Minister and now he's on way. Within 5 minutes, bata rahe, join karenge.
वो सीएम क्या से निकले हैं बताया जो है मीटिंग से निकले सीएम की मीटिंग से जो 5 मिनट लग रहा है उधर
Our comfort break gets extended.
Sir, we had the privilege of seeing the first lady of SVV University now, Madam Santosh Dhar. So we welcome her, sir.
No, you had the privilege. I don't have the privilege. No, I'm not taking it here. I request her to come to the video, sir. We will be happy to see her and get your blessings as well.
Sir, now she is there. Dr. Santosh Dhar. Namaskar, madam.
Namaskar.
Namaskar. Pranam, madam. Kaisa hai, madam?
All well.
Thank you.
Namaskar, madam.
Bahut acha. Thank you. Okay.
How are you, sir?
Doing well. Thanks for all your support to our Vice Chancellor, Dr. Ubendra Dhar.
Sir, our pleasure. Our pleasure.
Yeah, he is a very knowledgeable and his experience is being used by AIU at the maximum. We love him. I will like him. Okay.
So, did you attend the conference for both the days?
I attended the first day, not since morning.
Okay. So, you are also into teaching?
Yeah.
So, what is your subject?
Management.
Management.
Oh, both of you belong to same discipline, management.
Yeah.
Okay,
Our president is also from management.
That's okay. Yeah. Professors of management are really good leaders, right?
They are all very nice, sir.
She wrote an article on third dimension for University News, this issue, third dimension of universities. It's a wonderful article.
Oh, good. Madam Secretary General, I have spoken sufficiently. No need for me to deliver a speech in the valediction. You can just to say a few words and allow the minister to speak and of course hosting Vice Chancellor. You can wind up.
So we all will be speaking few words only, sir. We will wait for the minister to speak more words.
Okay. Need not.
President has to speak, maybe few words, but president has to speak.
Ubendra Dhar will not speak because our wife is available, in front of her speaking is very difficult for him.
The president is giving a hint to everybody to be brief.
Yes.
Because some of our own friends not taken their lunch even. Okay. Mrs. Vice Chancellor, Madam, we made a request to our Vice Chancellor. See, in Tamil Nadu and all, during Corona,
Minister से join कर लिया.
Hello, give the correct information, sir.
ज्वाइन
Sarang साहब अपनी ज्वाइन कर लें. Yeah, namaskar.
Namaskar, sir. Namaskar.
Anand, we can start now.
Yes, Rupali ma'am.
Yes, sir. So good afternoon and a very warm welcome to the Honorable Chief Guest, Shri Vishwas Kailash Sarang, Honorable Minister Medical Education, Bhopal Gas Tragedy Relief and Rehabilitation, Government of Madhya Pradesh, all respected dignitaries and eminent participants. There is a saying, all good things end. So we have come to the end of this wonderful Central Zone Vice Chancellors meet. On behalf of Shri Vaishnav Vidyapeeth Vishwavidyalaya Indore, I welcome you all to this valedictory ceremony of the Central Zone Vice Chancellors meet organized by Association of Indian Universities in partnership with United Nations and hosted by Shri Vaishnav Vidyapeeth Vishwavidyalaya Indore. In these 2 days, we have had deep insights into realizing Sustainable Development Goals 1, 2, 3, and 6 through higher education institutions for securing basic essentials of well-being. We had Vice Chancellors of Indian Universities, experts from United Nations systems, line ministries in Government of India, apex bodies of higher education and academia in this Vice Chancellors meet, who gave many vital recommendations to realize these goals. So on behalf of the university, we are delighted to host the prestigious AIU Vice Chancellors meet. Next is the virtual floral welcome of the guest. So I request Vice Chancellor of Shri Vaishnav Vidyapeeth Vishwavidyalaya and Chancellor of Shri Vaishnav Vidyapeeth.
I am not able to listen.
Yes, technical team may take care.
Yes.
I request Chancellor and Vice Chancellor of Shri Vaishnav Vidyapeeth Vishwavidyalaya to virtually welcome Honorable Chief Guest Shri Vishwas Kailash Sarang, Honorable Minister Medical Education Bhopal Gas Tragedy Relief and Rehabilitation, Government of Madhya Pradesh and other dignitaries. I request technical team to facilitate. Thanks to dignitaries for gracing the event and giving their valuable time to us. A pessimist complains about the wing, an optimist tries to change it, and a leader adjusts the sails. The sails for this particular notion was adjusted by a person who is not only a great motivation to all of us, but a visionary and the person who gave us the belief to bring together this event. He is none other than our respected Vice Chancellor. May I take the pleasure of requesting Vice Chancellor of Shri Vaishnav Vidyapeeth Vishwavidyalaya, Dr. Upendra Dhar, for the address.
Chief guest on this occasion, Shri Vishwas Ji Sarang, Honorable Minister of Health Education, Madhya Pradesh, President of the Association of Indian Universities, Colonel Dr. G. Thiruvasegam Ji, Vice President of the Association of Indian Universities, Dr. Suranjan Das, Secretary General of the Association of Indian Universities, Dr. Mrs. Pankaj Mittal, our very active team from the headquarters of the Association of Indian Universities, Dr. Rama Devi Pani, Dr. Alok Mishra, with the technical support by Mr. Vijendra Kumar, team from the university led by Dr. Anand Rajawat, esteemed Vice Chancellors, dignitaries, distinguished speakers, and friends. At the outset, I would like to welcome Honorable Minister on behalf of the Association of Indian Universities and post-university Shri Vaishnav Vidyapit Vishwavidyalaya. We had excellent speakers and very meaningful technical sessions during the meet. And the credit of inviting the very well and knowledgeable speakers goes to the team at our headquarters, Association of Indian Universities, led by Dr. Pankaj Mittal and coordinated by Dr. Rama Devi Pani. We now know, in fact, it gets endorsed that the 17 goals with 169 targets and 232 indicators are interlinked. These are interlinked global goals designed to be a blueprint to achieve a better and more sustainable future for all people and world by 2030. Each goal typically has 8 to 12 targets, and each target has between 1 and 4 indicators used to measure progress toward reaching the targets. I may sound repetitive if I would proceed on saying what has been shared during the technical section. Since we are having a presentation as a report of the whole meet, therefore I stop here and once again welcome the Honorable Minister to this meet, to the valedictory session, and all esteemed Vice Chancellors for this session. Thank you very much.
Thank you, sir. Thank you so much. Collective work is the secret behind the progress that this AIU Vice Chancellors meet has seen. To present the report of the event, I would like to welcome Dr. Namrata Jain from Sri Vaishnav Vidyapit Vishwavidyalaya to read the report.
Thank you, Ma'am Rupali. A very good afternoon and warm welcome to all Honorable Chancellors, Vice Chancellors, dignitaries and guests to this valedictory session. It is indeed an honor to share the dais virtually with so many eminent dignitaries and a proud privilege to present the report of prestigious Central Zone Vice Chancellors meet on realizing sustainable development goals through higher educational institutions for securing basic essentials of well-being. The meet was inaugurated. The meet was inaugurated by Chief Guest Padma Vibhushan, Dr. Anil Kakodkar, on January 2022 with lighting of holy lamp and invoking blessings of Ma Saraswati. Dr. Upinder Dhar, Honorable Vice Chancellor, SVV, delivered the welcome address and highlighted the significance of a right mix of policies, importance of collaborative efforts, leadership, science and technology in achieving sustainable development goals. Dr. Mrs. Pankaj Mittal, Secretary General AIU, in her introductory address mentioned about initiatives taken by AIU in achieving sustainable development goals. Shri Purushottam Das Ji Pasari, Honorable Chancellor, shared about the contribution of Shri Vaishnav Trust towards upliftment of society. Colonel Dr. G. Thiruvasagam, President AIU and TCM University, in his presidential address, emphasized the significance of deliberations of zonal conferences in achieving SDGs. The guest of honor, Dr. Govindasamy Vishwanathan, mentioned the challenges in functioning of HEIs. On this occasion, a special issue of University News, a weekly journal of higher education edited by Dr. S. Ramadevi, AIU, was released by the chief guest along with the distinguished guests. Padma Vibhushan Dr. Anil Kakodkar highlighted the need of close partnership of academia, industry, and government to bridge the disparity between urban and rural for Atmanirbhar Bharat. Dr. Anand Rajawat, Director SBIT and Nodal Officer of the conference, proposed vote of thanks. The key recommendations of inaugural session are: Notification and regulations on NEP 2020 are required by apex body of UGC and EICT. State and central government should disburse funds to HEIs for carrying out research projects. Use of science and technology for making agriculture practices sustainable is required. Citizens' health should be priority, which demands capacity building in terms of health workers, strengthening hospitals, and increase in number of seats in medicine. Massive upliftment for rural India by ensuring livelihoods in manufacturing sector through partnerships is must for self-reliant India. On the day one, we had interface with officers from apex bodies, wherein the chairperson was Professor Suranjan Das, Vice President AIU and VC Jadavpur University, Kolkata, and co-chair Dr. Mrs. Pankaj Mittal. The speakers for this session were Dr. R.C. Agrawal, Dr. Rajendra Kakade, Dr. Jagannath Patil, and Dr. Vinita Sahu. The recommendations were, there is a need for a strategic planning for improving agricultural higher education. New courses of relevance is introduced for improving course curriculum, understanding the policy document by NEP 2020. More focus on people, process, and technology, and concentration more on rural youth for employable education. In the day one, there was technical session first, focusing on ending poverty in all its forms everywhere. The chairperson for the session was Dr. Ajay Kumar Singh, Honorable Vice Chancellor, Sri Sri University, Cuttack, and the speakers were Ms. Ami Mishra, Mr. Praveen Mahato, Mr. Ajit Pai, and Dr. Jagatanand. The key recommendations: Niti Aayog and HEIs should collaborate for implementing sustainable development goals. Feedback mechanism in higher education institutions need to be strengthened through alumni networks. Establishment of higher educational institutions in rural areas with emphasis on multidisciplinary education is imperative. Agriculture should be a mandatory course rather than elective across higher educational institutions for all disciplines. Rural immersion programs, localization of sustainable development goals are crucial for eradicating poverty. On the day one, there was another technical session too, wherein the chairperson was Dr. Tej Pratap, Honorable Vice Chancellor, GBPUAT University. The speakers for the session were Mr. Bishop Parujili, Mr. Yogesh Kumar, Mr. Prashant K. Swan, and Dr. Firoz Hossain. The key recommendations: rent-fed area development and investment in natural farming system is recommended for attaining SDGs. On day two, technical session 3, the chairperson for the session was Professor Kavita Sharma, former President, South Asian University, New Delhi. And the speakers were Dr. Rakesh Sarwal, Dr. Vishal Chauhan, Dr. Kakuli Ghosh, Dr. Poonam Mutreja, and Dr. Indrani Gupta. The key takeaways of this technical session: higher educational institutions should take efforts to prevent and reduce the use of tobacco among youth. Higher educational institutions should frame strategies so that rural areas can avail the benefits of Aishma Bharat Yojana. There was one very important session, AIU business session, wherein the chairperson was Colonel Dr. G. Thiruvasagam, President AIU and VC Ahmed University, and convener Dr. Mrs. Pankaj Mittal, Secretary General AIU. Willing contribution and proactive participation of higher educational institutions is imperative for attaining sustainable development goals. In this session, the chairperson also shared the schemes of AIU in the area of research, publication, joint conferences for the benefit of faculty members and students. The technical session 4 focused on clean water and sanitation, that is Sustainable Development Goal 6. The chairperson was Dr. Alok Chakraval, and the speakers were Mr. Nicholas, Dr. Avinash Mishra, Mr. Sameer Kumar, and Professor Dr. Raja Shekhar. Key takeaways are: higher educational institutions should take initiatives to promote Jal Shakti Abhiyan in their campuses. Behavioral change is required for attaining sustainable development goals. Circular economy with special emphasis on waste management holds particular promise for attainment of sustainable development goals. This is the valedictory session wherein we are honored to have the Chief Guest Shri Vishwas Kailash Sarang, Honorable Minister, Medical Education, Government of Madhya Pradesh. These are the glimpses of the 2 days prestigious occasion. Thank you, everybody.
Thank you, ma'am, for the nice report presentation. Dr. Mrs. Pankaj Mittal, Secretary General at Association of Indian Universities, AIU, is the planner and designer of this meet. We all have witnessed how magnificent the meet was. Her idea of bringing experts from different agencies like Ministry, Niti Aayog, apex bodies, academics, etc., is a secret behind the success of the meet. Ma'am, we see you as one of the most pleasant officers who is a team player and a role model. I welcome you, ma'am, for your remarks.
Thank you, Rupali. Thanks for your kind words. Honorable Minister for Medical Education, Bhopal Gas Tragedy Relief and Rehabilitation Measures, Government of MP, Shri Vishwas Kailash Sarang ji. Honorable President of AIU, Professor G. Thirubusagam ji. Honorable Vice Chancellor of Shri Vaishnav Vidyapeeth, Professor Upendra Dhar ji. All the participating Vice Chancellors who are attending this meet, the entire team of Vaishnav Vidyapeeth who is with this particular conference, and the entire team of AIU who has been constantly working on this particular conference. Ladies and gentlemen, a very warm welcome to all of you on the valedictory session, and a big thank you to all of you for joining, and especially to Dr. Upendra Dhar and his team for flawlessly organizing this particular conference. Normally in many conferences, especially if they are run online, there are many technical glitches, there is something, somebody is coming, we have to wait, something, but nothing happened at all. So many congratulations to Dr. Upendra Dhar and the coordinator, Dr. Anand Rajawat, for holding this particular meet flawlessly on behalf of AIU. We are really grateful to you. For the Honorable Minister, sir, as you heard the report of the conference, we had the conference on 4 SDGs. I just wanted to apprise you that in AIU, which is a body of about 870 universities, we are engaged in a number of activities like academics, research, equivalence of foreign degrees with the Indian degrees, then including sports and youth affairs activities for the Indian university. So we run many youth affairs and sports programs also, because we believe in the holistic development of the students. And we do bring a number of publications on issues of academic interest for the higher educators. So we do hold 5 zonal and 1 main conference every year. And every year there is a theme of the conference. For example, last year the theme was on implementation strategy for national education policy. And in the end of the conference, we brought out a report which gave in detail for every recommendation of NEP that what is the action to be taken, who is the actor responsible, what are the timelines, and what are the performance indicators for that. Similarly, this year we thought that because 17 SDGs have to be realized by 2030, we just have 9 years to go, and not many higher education institutions are knowing that what they can do to contribute in realizing the SDGs. Therefore, we felt that all the 6 meets should be dedicated to how higher education institutions can contribute in realizing the SDGs. So we have clubbed 4 SDGs. For this meet, it was 1, 2, 3, and 6. So this is the 4th conference in the run. So already 16 SDGs are over. The 5th conference, which will be in Bharatiya University, the South Zone Conference, that will be considering 1 SDG, that is SDG 4, which is on higher education. And in the main conference, which will be held in Mysore, all the 17 will be discussed threadbare. And in the end, again, we will bring a report like we brought last year on the NEP. We'll bring a report which will indicate that how higher education institutions can contribute in realizing the SDGs individually for each SDG. So there will be 17 chapters chapters will be there in that report. For each SDG, what is the present status, what the higher education institutions can do on their own campuses, what type of policy research they can do, and what type of suggestions you want to give to the universities, to the United Nations, to the line ministries, as well as to the regulatory authorities in ensuring that higher education institutions contribute significantly to the realization of the SDGs. So I'm sure this will be a very sought after document in the higher education sector. And I'm also happy to inform you, sir, that the United Nations is also collaborating with us in this project. So that's why we could have the experts from the United Nations in each and every session. Like every session, there is an expert from United Nations, there's an expert from Niti Aayog, there is an expert from the line ministry, and there is one academic who is attending these conferences. So we had very good deliberations. All the meets, we are having very good deliberations, and we hope to come out with a very good document at the end of it. We'll be sending the document to all the governments, to your good self also, sir. And I think it will be a very good document. So once again, I would like to thank the Honorable President AIU for always encouraging us to do good things, to the Vice Chancellor of Vaishnav Vidyapeeth for organizing this particular meet, to all the participating Vice Chancellors who have been very kind and who have been giving very relevant suggestions, to the entire team of the Vaishnav Vidyapeeth. They had really worked very hard. So many preparatory meetings were held for this meet. To my own team, Dr. Rama is there, Satyapal is there, Dr. Alok Mishra is there, Vijinder is there. They all were very, and even Shivam, who was giving the technical support, and all this, I mean, even the valedictory session is going live on YouTube through the AIU Twitter handle. So thanks to all my team members for doing it so well. So thank you very much. Thanks a lot. Thank you, sir.
Thank you very much, ma'am, for your humble words and remarkable address. We all have seen Colonel Dr. G. Thiruvasagam, President, Association of Indian Universities, standing as pillar throughout the meet in all sessions, providing guidance and support and sharing blessings. To have such a leader is the fortune of AIU. Sir, I personally learned a lot from your personality and leadership skills, particularly eminence combined with humbleness. I bow you, sir. For this valedictory session, you are the chief host. I welcome you, sir, to deliver the presidential remarks.
Honorable Minister for Health and Medical Education, Sri Vishwas Sharing, Honorable Vice Chancellor of the hosting university and the governing council member of AIU, Dr. Ubendra Dar, beloved and respected Secretary General of Association of Indian Universities, my colleagues of AIU, Dr. Alok Mishra, Dr. Mrs. Pani, Sri Vijayender, Sri Satyabal, and Siva, respected faculty members and officials of the hosting university, most importantly, the participating Vice Chancellors. First of all, I would like to convey my pranam to the Honorable Minister. Our Minister finds time to come and attend this conference in spite of his heavy schedule. We were told that our Honorable Minister was with the Honorable Chief Minister just a few minutes ago. Such a way, Minister is very busy with all his ministerial activities and finds time to come to this conference. It shows how much love and affection he has with the discipline of education and respect he has on higher education institutions and the institution of Association of Indian University as well. So thank you very much and pranam, Minister sir. Thank you very much. Likewise, I would like to endorse the good words spoken by my colleague, Dr. Pankaj Mittal, about the hospitality, of course, virtual hospitality to us, and the facilities extended to AIU and all the Vice Chancellors. Certainly, we will carry all these green memories forever, sir. and your team. We have seen many universities and many conferences, but as far as the team from SEEE cannot be compared as well. Starting from Master of Ceremony, technical team, and the professors, the coordinators, they have done really a good work. So on behalf of the AIU, once again, I would like to thank the Vice Chancellor and especially the Chancellor of the University as well. Thank you very much indeed, sir. I don't want to take much time. I have spoken sufficiently earlier and indirectly indicated the Master of Ceremony also. I have spoken on many occasions as well. Only a few more minutes. Honorable Minister, sir, we have been working to improve and enhance the quality of higher education. We are very, very particular about providing employable education to the youths of the country as well. The major challenge and issue before us is giving employment or organizing employment for the eligible qualified graduates. So all along, we Vice Chancellors, we are totally involved in designing a curriculum and enriching the research and whatever possible way to do something to the community under the heading of extension activities. Now the UNESCO wants, UNESCO said, how long you are going to be only a degree awarding institutions? Why not you think about something needed by the country, something required by the Honorable Prime Minister of India, something required by the forefathers of the country as well. That is nothing but you work for poverty, you work for eradication of hunger, you work for health, you work for many other things, which is the need of the country. Okay, where the poverty people are living below poverty line even after 70 years of independence. To address the call made by UNESCO, AIU taken it as a challenge. First of all, to educate the Vice Chancellors. I should openly acknowledge that though I am in the higher education for the last 5 decades and I have 16 years of Vice Chancellorship, the last 2 days what I have learned from the experts, from the UNESCO, from the government, from the research institutions cannot be taken just like that. So now AIU had an opportunity of educating all the Vice Chancellors about what is SDGs numbering 70, how we can take forward to the student friends along with the other curriculum and research program and projects. So I must thank once again Dr. Pankaj Mittal, my colleague, and Dr. Bani, Mrs. Bani. They only fixed the guests and they are not ordinary people. Most of them are policymakers. Most of them are working very close with the office of the Prime Minister. Most of them are working very close with the international organization. It is very, very difficult for Vice Chancellors to get such people to give a lecture as well. So thank you, Madam, for organizing such experts for this conference. We are really benefited out of it, sir. And we will carry out all these memories along with us. I give assurance to Honorable Minister, sir. We Vice Chancellor take things very seriously and to see that all the SDG 17 will be implemented in our curriculum, in our research program, in our outreach activities, sir. Thank you very much once again to all of you for the opportunity given to me, sir. Thank you very much, sir.
Thank you so much, sir, for your nice words. It's an honor for us that Shri Vishwas Kailash Sarang, Honorable Minister, Medical Education, Bhopal Gas Tragedy Relief and Rehabilitation, Government of Madhya Pradesh, is the chief guest in this event. Mr. Vishwas Kailash Sarang, firebrand youth leader of BJP, is well known to all the states of people of Madhya Pradesh. He has been elected 3rd successive times from Narela Assembly constituency of Bhopal from the year 2008 to 2013, 2013 to 2018, and 2018 to at present. He has been the Minister of Madhya Pradesh, Cooperatives, Bhopal Gas Tragedy Relief and Rehabilitation and Rural Development from the year 2016 to 2018. At present, he is the Minister of Madhya Pradesh, Health Education, Bhopal Gas Tragedy Relief and Rehabilitation. He has been a member of executive committees of BJP. He has also been the president of BJYM from the year 2007 to 2010 of Madhya Pradesh, during which he formulated the first ever youth policy for the state. Before that, he has served the BJYM in different capacities since 1993. He is equally involved in socio-cultural events like All India Kayast Mahasabha, Young Wing of Madhya Pradesh, Hindu Utsav Samiti, Council of Civil Rights Protection, Madhya Pradesh, Industrial Association of Software and Services. He also visited many countries. Mr. Vishwas Kailash Sarang is a man of the masses, firm in his political convictions, holds the distinction of being a well-educated politician, having earned a bachelor's degree in engineering from MIET, Gondia, Maharashtra, possessing mesmerizing, extraordinary, energetic oratory skills and expertise in organizational management. He leads the politics of chastity, cleanliness, integrity, and principles. It's a matter of great pride that Honorable Minister Shri Vishwas Kailash Sarang is the chief guest of this event. For enlightening us with their words, here I would like to call upon Honorable Minister Shri Vishwas Kailash Sarang ji.
नमस्कार। प्रोफेसर रूपाली ने मेरा परिचय बहुत लंबा दिया और मुझे बहुत ग्लोरीफाई किया। इसमें से बहुत सारी बातें ऐसी हैं जो बहुत मैं इत्तेफाक नहीं रखता हूं। मुझे बोला बड़ा फायर ब्रांड नेता, उसके लिए धन्यवाद रूपाली को। मैं बहुत बधाई दूंगा आज के इस कार्यक्रम में उपस्थित प्रोफेसर ध्रुवा सगम जी, अध्यक्ष AIU, डॉक्टर पंकज मित्तल जी, मेरे बहुत ही अभिन्न मित्र, और जिन्होंने मुझे ये अपॉर्चुनिटी दी कि मैं आप सबसे मुखातिब हो पाया, मिल पाया, डॉक्टर आलोक मिश्रा जी, डॉक्टर पुरुषोत्तम दास पसारी जी, हमारे ही मध्य प्रदेश के इंदौर के डॉक्टर धर साहब, डॉक्टर श्रीमती रमा देवी जी, प्रोफेसर रूपाली, और इस बहुत ही महत्वपूर्ण और 2 दिन के रिजल्ट ओरिएंटेड इस सेमिनार में उपस्थित सभी विशिष्ट जनों को मैं प्रणाम करता हूं। मैं AIU की सेंट्रल जोन की इस वाइस चांसलर की मीट में को आयोजित करने की आप सबको बहुत बधाई देता हूं। मैं डॉक्टर धर को भी बहुत बधाई दूंगा कि उन्होंने ये अपॉर्चुनिटी मध्य प्रदेश को दी, और ये बहुत अच्छी बात है कि उन्होंने इसको होस्ट किया, वर्चुअल किया। आगे मैं अपने जब अपनी बात समाप्त करूंगा तो एक इनविटेशन डॉक्टर ध्रुवा सगम को जरूर दूंगा, पर आखिरी में दूंगा। बहुत ही महत्वपूर्ण विषय पर 2 दिन तक ये सेमिनार चला है, और जो 17 SDGs हैं उसमें से 4 बहुत महत्वपूर्ण SDG पर 2 दिनों तक आप लोगों ने, सब एक्सपर्ट ने बातचीत की। और निश्चित रूप से जब हम हिंदुस्तान की बात करते हैं और दुनिया की किसी भी समस्या को लेकर बात करते हैं, अब जैसे 17 SDGs की बात हम जब करते हैं तो संयुक्त राष्ट्र संघ ने इन 17 SDGs पर चिंता व्यक्त की है, और 2030 तक इनको पूरी दुनिया को अचीव करना है, इनको खत्म करना है, इन समस्याओं को समाप्त करना है। इस पर जब बातचीत होती है तो निश्चित रूप से ऐसे सब विषय पर हिंदुस्तान की भागीदारी सबसे महत्वपूर्ण होती है। यदि हम भौगोलिक दृष्टि से देखें, यदि हम हमारी जनसंख्या की दृष्टि से देखें, या हमारे इतिहास को देखें, तो निश्चित रूप से दुनिया को दिशा देना और दुनिया की किसी भी समस्या के निराकरण में जो हमारा दर्शन है, जो हमारी फिलॉसफी है, जो हमारी पुरातन व्यवस्थाएं हैं, वो कहीं ना कहीं हमें लगती हैं कि बहुत महत्वपूर्ण है। और इसीलिए आज की तारीख में वैसे भी हिंदुस्तान उस स्थान पर है, और मुझे इस मंच पर कहते हुए कहीं संकोच नहीं होता कि इस देश के यशस्वी प्रधानमंत्री नरेंद्र मोदी जी के नेतृत्व में हिंदुस्तान में वैश्विक स्तर पर, इंटरनेशनल मंच पर जिस प्रकार से हिंदुस्तान अब लीडर के रूप में स्थापित हुआ है, चाहे वो सस्टेनेबल डेवलपमेंट की बात हो, पर्यावरण की बात हो, या आज की इस पेंडेमिक में जब हम देखते हैं कि कोरोना ने पूरी दुनिया को हिलाकर रखा है, उस समय पर इस देश में नरेंद्र मोदी जी के नेतृत्व में जिस प्रकार से काम किया है, पूरी दुनिया ने उसका लोहा माना है। वैक्सीन की बात हो, वैक्सीन बनाना तो बहुत चुनौतीपूर्ण था ही, पर मुझे उससे ज्यादा चुनौतीपूर्ण लगता है वैक्सीन को लगाना। पर नरेंद्र मोदी जी की लीडरशिप में जिस प्रकार से वैक्सीनेशन प्रोग्राम को डिजाइन किया गया, और आज हम बहुत फख्र के साथ कहते हैं कि लगभग 150 करोड़ लोगों को हमने वैक्सीन का डोज लगवाया है, ये सब इस देश की उन व्यवस्थाओं को दुनिया के सामने लाकर रखता है, जिसमें हम ये कह सकते हैं कि हिंदुस्तान बहुत तेजी से दुनिया के हर समस्या के निराकरण के लिए अग्रणी के रूप में काम करता है। जिन 4 SDGs पर बात हुई है, डॉक्टर मित्तल को मैं बहुत बधाई दूंगा, उन्होंने 3 मिनट के अंदर पूरी इस कॉन्फ्रेंस के बारे में बताया, और जैसा उन्होंने बताया कि अलग अलग ग्रुपों में 4-4 SDGs पर बातचीत हुई है, और उन सबको कंपाइल करके आप एक रिपोर्ट तैयार करने वाले हैं। मुझे बहुत प्रसन्नता है। अभी प्रेसिडेंट साहब ने भी बताया कि 2 दिन में एक्सपर्ट्स ने वो कुछ कहा, उन्होंने तो इसको जिस ढंग से बताया कि 50 साल के पूरे जो उनका इतना बड़ा कार्यकाल है, उसमें ये 2 दिन बहुत महत्वपूर्ण रहे, जिनमें अलग अलग विषयों पर बहुत ही विद्वत्ता के साथ लोगों ने अपने विचार रखे। निश्चित रूप से जिन SDGs पर संयुक्त राष्ट्र संघ ने फोकस किया है, वो दुनिया की तस्वीर और तकदीर बदलने वाली है। यदि उन सब पर हम मुकाम पा सकते हैं, यदि उन सब को हम अचीव कर सकते हैं, उन समस्याओं का हल कर सकते हैं, तो निश्चित रूप से दुनिया की अलग स्थिति बनेगी। जैसा मैंने अपने वक्तव्य के शुरू में कहा कि हिंदुस्तान आदि अनादि काल से दुनिया का नेतृत्व करता रहा है। यदि हम बात करें, हम किसी धार्मिक आयोजन की बात करते हैं, तो हम एक नारा लगाते हैं, हम कहते हैं धर्म की जय हो, अधर्म का नाश हो, प्राणियों में सद्भाव हो और विश्व का कल्याण हो। हम केवल अपनी बात कभी हमने नहीं की। हम यदि सस्टेनेबिलिटी की बात करते हैं, तो निश्चित रूप से मानव जाति की हम बात करते हैं। हम कहते हैं कि विकास केवल हमारा नहीं, यदि सतत विकास की हम बात करते हैं, तो निश्चित रूप से विकास के साथ साथ सामाजिक चेतना, पर्यावरण संरक्षण, और जो अंग्रेजी का एक शब्द है कि स्पेस देते हुए, सब लोगों का ध्यान रखते हुए हम विकास की बात करें। इसलिए जब भी हम अपने धर्म की बात करते हैं, तो पूजा के पहले और पूजा के आखिरी में हम यही कहते हैं, धर्म की जय हो, अधर्म का नाश हो, प्राणियों में सद्भाव हो और विश्व का कल्याण हो। हम केवल अपनी बात नहीं करते, केवल अपने परिवार, अपने शहर, अपने प्रदेश, अपने देश तक को हम सीमित नहीं रखते। हम कहते हैं विश्व का कल्याण हो, वसुधैव कुटुंबकम। हम कहते हैं ये पूरी वसुधा, ये पूरी पृथ्वी, ये हमारा परिवार है। और इस विचार को लेकर जब हम आगे बढ़ते हैं, तभी शायद ये SDGs जो संयुक्त राष्ट्र संघ ने हमारे सामने रखे हैं, उन सबको हम अचीव कर सकते हैं। इसलिए मुझे लगता है कि हिंदुस्तान के विचार, हमारी वो सब बातें जिनको लेकर ये हिंदुस्तान की पहचान नहीं है, इनको गुणता देते हुए यदि हम आगे बढ़ेंगे, तो शायद हम इन SDGs को प्राप्त कर सकेंगे। चाहे वो गरीबी की बात हो, चाहे लोगों को की भूख की समस्या को हल करने की बात हो, चाहे कृषि की उन्नतता की बात हो, चाहे पर्यावरण संरक्षण की बात हो, चाहे पानी और सैनिटाइजेशन को लेकर विचार रखने की बात हो। मुझे लगता है इन सब पर निश्चित रूप से 2 दिन में जो विचार हुए हैं, वो आगे आने वाले समय में पूरी दुनिया को एक संदेश देंगे। और मुझे इस बात की बहुत प्रसन्नता है, मैं AIU को इस बात की बहुत बधाई दूंगा, जिस फोरम पर इन सब विषयों पर बातचीत हुई है, वो शायद बहुत महत्वपूर्ण है। देखिए, 2 बातें हैं। जब हम हायर एजुकेशन की बात करते हैं, तो ये केवल हम किसी एक संस्थान की बात नहीं करते, बल्कि हम उस संस्थान की बात करते हैं जो समाज के आगे आने वाले नागरिकों का निर्माण करता है। और जब हम किसी व्यक्ति के निर्माण से जुड़ी हुई संस्था में इस तरह के विषय पर विचार विमर्श करते हैं, तो निश्चित रूप से हम ये कह सकते हैं कि आगे आने वाले समाज का उत्तरदायित्व जिनके कंधों पर है, उन तक ये बात बहुत सही समय पर और सही ढंग से पहुंच सकेगी। इसलिए जब वाइस चांसलर के फोरम पर, उस मंच पर इस तरह के बहुत महत्वपूर्ण विषय पर कोई वार्तालाप होता है, तो मुझे लगता है कि उसका जो रिजल्ट है, उसका जो आगे आने वाला जो लक्ष्य है, उसको साधने में निश्चित रूप से बहुत ही सफलता मिलेगी। मैं बहुत प्रसन्नता के साथ डॉक्टर मिश्रा को, आलोक मिश्रा जी मेरे परम मित्र हैं, मैं उनको बहुत धन्यवाद दूंगा कि उन्होंने मुझे इस महत्वपूर्ण विषय पर जुड़ने का मौका दिया है। जैसा मैंने कहा कि हमारे देश के यशस्वी प्रधानमंत्री नरेंद्र मोदी जी ने इस बात को स्थापित किया है कि हर विषय पर अब हिंदुस्तान दुनिया को लीड भी कर रहा है, दुनिया को दिशा दिखाने में बहुत अग्रणी भूमिका निभा रहा है। तो निश्चित रूप से इन एसएसडी जो 2030 तक पूरी दुनिया को अचीव करना है, उनको अचीव करने में और उनको सही रूप से इन समस्याओं का हल करने में हिंदुस्तान अग्रणी रहेगा। और उस जो बड़ा मिशन है उसमें ये 2 दिन की कॉन्फ्रेंस मील का पत्थर साबित होगी, मैं ऐसी आशा करता हूं। मुझे बहुत प्रसन्नता है इस कार्यक्रम में जुड़ने की। और जैसा मैंने कहा कि इस वर्चुअल मीट को उपेंद्र जी ने होस्ट किया था। मैं प्रेसिडेंट साहब को एक ऑफर देना चाहता हूं। जैसा डॉक्टर मित्तल ने बताया कि 4 ग्रुप की जो भी रिकमेंडेशंस हैं उनको कंपाइल करके आप एक रिपोर्ट तैयार कर रहे हैं, तो मैं ये कहूंगा कि मध्य प्रदेश को आप ये मौका दें कि जब इस रिकमेंडेशन को आप रिलीज करेंगे तो फिजिकली मैं सबको इनवाइट करूंगा। भोपाल में एक हम प्रोग्राम करते हैं और उसको हम होस्ट करेंगे, और यदि आप उसको एक्सेप्ट करते हैं तो फिर पूरी दुनिया में संदेश जाएगा। और ये 17 की 17 जो हमारे जो एसडीजी हैं उनको हम जितने 17 एसडीजीज के जो आपकी रिपोर्ट बनेगी, हम उस एसडीजीज की पूरी रिपोर्ट को भोपाल से हम रिलीज करें, ये मैं आपको आमंत्रण देता हूं। यदि हमारे प्रेसिडेंट साहब इसको हामी भरते हैं तो आई विल बी हैप्पी टू होस्ट। और एक बात मैं और कहना चाहता हूं, देखिए हम फेडरल सिस्टम में रहते हैं, हम दुनिया की बात कर रहे हैं तो दुनिया में हिंदुस्तान है और हिंदुस्तान में फिर हमारी अलग अलग गवर्नमेंट है। तो ये जो भी एसडीजीज हैं उनके जो आपकी रिकमेंडेशंस होंगी, मैं आपको विश्वास दिलाता हूं मध्य प्रदेश सरकार के प्रतिनिधि होने के नाते कि आपकी रिकमेंडेशंस को हम पूरी तरह सरकार के माध्यम से हमारे प्रदेश में इंप्लीमेंट करने की कोशिश करेंगे, जो मुझे लगता है कि सबसे जरूरी रहेगा। तो मैं आपको दोनों चीजों का विश्वास दिलाता हूं, जो भी आपकी रिकमेंडेशंस होंगी इन एसडीजीज को अचीव करने के लिए, दुनिया की इन समस्याओं को समाधान करने के लिए, हिंदुस्तान में यदि हमें समाधान करना है तो निश्चित रूप से मध्य प्रदेश को भी उसमें अग्रणी भूमिका निभानी पड़ेगी। मोदी जी के नेतृत्व में फेडरल सिस्टम, ये जो इस देश का केंद्र और राज्यों के बीच के संबंधों को मजबूत करते हुए देश की सरकार जो चल रही है, उस सिस्टम को और मजबूत करते हुए जितने भी ये जो एसडीजीज हैं उनको अचीव करने के लिए हमारी सरकार को जो कुछ करना होगा, मैं आपको विश्वास दिलाता हूं आपके रिकमेंडेशंस को हम पूरी तरह से मध्य प्रदेश में उसका पालन करेंगे। और उसके साथ साथ आपकी जब ये रिपोर्ट विस्तृत रूप से बनती है और इसको रिलीज करने का कोई यदि आप प्रोग्राम डिजाइन करते हैं तो उसमें मैं आपको ऑफर करता हूं कि मध्य प्रदेश आप आइए, भोपाल आइए। आपने सेंट्रल जोन की वर्चुअल होस्ट हमारा जो था, मैं तो मानूंगा उपेंद्र जी ने जो किया है उसमें मैं भी शामिल हूं। हम मध्य प्रदेश वाले सब, इंदौर हमारी बहुत ही मजबूत शहर है, हिंदुस्तान का सबसे साफ सुथरा शहर है, बहुत अच्छा है। और भोपाल भी हमारा नेचुरल कंटूर पे बसा हुआ शहर है, बहुत ही सुंदर शहर है। तो मैं आप सबको ऑफर करूंगा, आप सबको इनवाइट करूंगा कि इसकी जब आपकी रिपोर्ट बनती है तो उसको फिजिकली यहाँ पर एक बड़ा प्रोग्राम करके हम उसको रिलीज करें। उसकी जो भी व्यवस्थाएं होंगी उन सब व्यवस्थाओं की जिम्मेदारी हम लेंगे। मैं एक बार पुनः ध्रुवा सगम जी को बहुत धन्यवाद देता हूं, बहुत बधाई देता हूं। एक बहुत ही महत्वपूर्ण और बहुत ही मीनिंगफुल और मौजूद, एक उर्दू का बहुत अच्छा शब्द है मौजूद, जिसकी आज सबसे सस्टेनेबल डेवलपमेंट को लेकर पूरी दुनिया में बातचीत चल रही है। और 2030 की यदि हम बात करते हैं तो समय अब हमारे पास बहुत कम बचा हुआ है। दुनिया को सही मायने में ऐसे अलग अलग फोरम पर विचार करके, केवल विचार करके नहीं बल्कि उसकी रिकमेंडेशन को इम्प्लीमेंट करके इन सब गोल्स को अचीव करना है। ये गोल हम अचीव करेंगे इसी संकल्प के साथ। मैं ध्रुवा सगम जी को, पंकज मित्तल जी को, पुरुषोत्तम पसारी जी को, उपेंद्र धर जी को, रमा देवी जी को, रूपाली जी को बहुत धन्यवाद देता हूं। पर उसके साथ साथ आलोक जी को धन्यवाद के साथ साथ बहुत ही इस बात का भी धन्यवाद देता हूं कि उन्होंने मुझे यहाँ इनवाइट किया और आप सबसे मिलने का, आप सबसे मुखातिब होने का, आपके विचार सुनने का मुझे मौका दिया। और डॉक्टर मित्तल को मैं यही निवेदन करूंगा कि ये जब रिकमेंडेशंस हो जाएं तो एक कॉपी यदि मुझे मिलेगी तो मैं उसको अध्ययन करके जो कुछ हमारी सरकार में हम इम्प्लीमेंट कर सकते होंगे वो हम करेंगे। बहुत बहुत धन्यवाद, आपको बहुत बधाई।
श्योर सर, श्योर, थैंक यू। हम आपको कॉपी जरूर भेजेंगे। और मध्य प्रदेश तो वैसे भी भारत का दिल है, तो अगर वहां पे अगर हमारी रिकमेंडेशंस रिलीज होती हैं तो हमें बहुत खुशी होगी। धन्यवाद सर।
डॉक्टर मित्तल, मध्य प्रदेश का दिल ही नहीं है, मध्य प्रदेश वाले दिलदार भी हैं।
नमस्कार सर।
Namaskar. Thank you so much.
Thank you, sir, for sharing your profound knowledge and giving valuable suggestions to achieve the Sustainable Development Goals with your influential message. It's always a pleasure for all of us to work under your guidance. Thank you, sir. Gratitude is the fairest blossom which springs from the soul. Every celebration is an experience, the external fades away and the internal lingers and echoes in the most depth of our hearts. We are reminded that events like this one are milestones on the journey of life. As we come to the close of our valedictory ceremony, before I invite Joint Secretary Meetings Associations of Indian Universities, Dr. Alok Mishra, to propose the words of thanks, I would like to thank on behalf of Shri Vaishnav Vidyapeeth Vishwavidyalaya Indore, the President of AIU and Vice Chancellor of M.Ed University, Chennai, Colonel Dr. Tiruvasagam sir, for giving us the opportunity to conduct the program. I thank Dr. Pankaj Mittal, Secretary General AIU, for her continuous guidance and support to conduct the meeting successfully. Last but not the least, I thank on behalf of whole organizing team at Shri Vaishnav Vidyapeeth Vishwavidyalaya to Dr. S. Rama Devi Pani for her contributions and holding continuously at each step to conduct this meet. I am personally thankful to you, ma'am. I also thank all the Vice Chancellors who are participating in these 2 days. Now I request Dr. Alok Mishra, Joint Secretary, Meetings Division, AIU, to propose the formal words of thanks. Over to you, sir.
Thank you, Rupali ji. First of all, I would like to thanks on behalf of AIU. I thank Chancellor Sri Purushottam Das Rashi sir and very dynamic Vice Chancellor Professor Upendra sir from Sri Vaishnav Vishwavidyalaya Indore, Vidyapeeth sometime it's come. So मुझे बहुत खुशी है कि बहुत ही सुंदर तरीके से इस कार्यक्रम को संचालित किया गया है और इस मुकाम तक पहुंचाया गया है। ये हृदय को छूने वाला है। हमने बहुत सारी यादों को अपने दिलों में सजोया है। But really, for wonderful hosting this Central Vice Chancellor Zone, we will remember it. The deliberation during the 2 days have been meaningful and enlightening for all. This is enlightenment. Just is not like to receiving the knowledge only something, but open the mind. And this, I think, this will be play a vital role for implementation. The program is successful due to the teamwork. I would like to thank the team of Sri basically Vaishnav Vidyapeeth again for successful organizing this meet. And heartily thanks to the chief guest. We know already the Dr. Anil Kakurkar sir, with the guest of and the guest of honor Dr. Our G. Vishwanathan ji. That the deliberation was so mature, and this was really the mind opening again. The words still is moving around, and we on the foundation of the first day of the inaugural, the meet was extended, meets were proceeded, and that was really very good. And the views are not enlightened personally, but really those really who attended, they also sent too many messages, thanks messages, so that we can understand how really people touched by the topic and by the organizing this meet. I'm thankful to our chief guest of the elected session. मैं हृदय से विश्वास शारंग जी का नमस्कार करना चाहूंगा कि वो 1 घंटे की नोटिस पे मैंने उनका बहुत सी चीजें हैं, उन्होंने कई प्रोग्राम कैंसिल किए और तुरंत उनकी टीम ने एक्टिवेट होकर के तुरंत इसको जो है उन्होंने स्वीकार किया। मैं सदैव आभारी रहूंगा आपका इस मित्रवत जो है आपके इस स्वीकारोक्ति के लिए जो है। और मेरा हार्टफुल थैंक्स टू द स्पीकर्स ऑफ द ऑल टेक्निकल सेशन एंड द चेयरपर्सन्स। उनका भी योगदान बहुत अच्छे थे। सारे चेयरपर्सन्स और टेक्निकल सेशन के जितने भी हमारे वक्ता रहे हैं, हमने देखा कि किस प्रकार से उन्होंने बहुत ही सूक्ष्म तरीके से, बहुत ही माइन्यूट साइलेंट फीचर्स को भी हमारे सामने रखा है। स्पेशल थैंक्स टू द कोऑर्डिनेटर, वी नो दैट डॉक्टर आनंद राजवत जी, बहुत अच्छा काम किया आपने, आपको बहुत बहुत बधाई, बहुत धन्यवाद। मास्टर ऑफ सेरेमनी प्रोफेसर रूपाली भारतीय जी, आपको बहुत बहुत धन्यवाद। रिपोर्टियर डॉक्टर आनंद बाबू जी, डॉक्टर नम्रता जैन, डॉक्टर सौरभ जैन, and IT division of the university. I thank all the honorable vice chancellors. We know without all of you, the program is not possible, because when you attend really the program, then the purpose of the program to discuss with all honorable vice chancellor. So you attended. That is really, I'm really thankful from my heart. Officials of the various ministries and all other the participants for making this session successful. Thanks to the Honorable President of AIU, Dr. G. Thirumazgam sir. Sir, I think everyone has really witnessed that. Sir is a really good orator, and beyond that, he's the power behind that. Always he make alert, and always we know that he on the camera at 9:15. He joined yesterday, so he was ready around 9 o'clock and 9:15. So. The program is going to start 10 o'clock. The sir was so vigilant and reached the first. So really, sir, I'm very thankful to you. And we are really blessed by the guidance and really motivation. The consent is not only just to as a president, but he's always encourager to do the best. What you can do, and always he prays for the good things. Thanks again, and I thank to Professor Ranjan Das sir, the Vice President of AIU, for his guidance and support. He's always us. And gratitude to the Honorable Secretary General Dr. Pankaj Mittal Madam, the constance and enthusiastic leadership for the VC meet. We know that how the madam is really. I'm very closely associate here in office, so we know that how madam is working day and night, and even then. Even trial session also madam attended, how things go and how it's how can we make the best. So thank you madam, and to always support for new ideas, anything we put forward. So madam is ready for that new thing. So this is a teamwork that. So the way the things reach, I would like to again do that the people who sometimes will work behind that we be unable to know. I thank the officials of AIU who have worked hard behind the scene to make this meet success. Rama Devi Pani ji, that's we all know that's always the editor University News. Vijendra Upadhyay, assistant meeting division our. Nishchat Palji and Rekha ji from SC office. Time you receive the letters and reminders, all important. Shivam Dikshit, the software engineer in the IT division, and Mr. Sushil, assistant from IT. This is basically the 2 days was very engaging and very again I'm saying that is enlightening for us. And wishing you all the safe and progressive year 2020-22. This is stay safe and healthy. नमस्कार, मैं ये कहूंगा कि वो नया दीप जला दें, तमस को मिटा दें, संकल्प की मसाल ले लक्ष्य को ललकार दें, धिक्कार है तुझे खिचक खिचक मिटा न सका, लक्ष्य को ना पा सका, एक दहाड़ दे कदम तू बढ़ा दे, हुंकार और शक्ति से बाधाओं को मिटा दे, सोच नहीं विवेक से चल, आगे बढ़। ये जो संकल्प एसडीजी के लिए गए हैं, ये जो हिंदुस्तान के लिए एक चैलेंज है, एक माननीय प्रधानमंत्री जी का आह्वान है कि इसमें 2030 तक पूरे करने हैं, और संपूर्ण जो विश्वविद्यालय संघ है इस माननीय प्रधानमंत्री जी के इस विजन और जो एसडीजी जो यूएन मिशन बनाए हैं फिक्स किए हैं, उसके जो हायर एजुकेशन कंट्रीब्यूट कर सकता है उसके लिए सभी लोग तत्पर हैं। और मैं इसी शब्दों के साथ और समापन करते हुए ये कहूंगा कि हम लोग जो हमारा राष्ट्रीय अधिवेशन है, मतलब नेशनल हमारी जो मीट है, वीसी मीट है, जो कि मैसूर में है, मार्च में जा रही 23rd, जैसा कि हमारा जो डेट्स है आप उसे ब्लॉक करके रखें जो है, और हम लोग वहां फिर मिलेंगे। और तब तक के लिए जो है एक बार पुनः नमस्कार, पुनः धन्यवाद। थैंक यू वेरी मच।
Thank you so much, Dr. Alok Mishra sir.
धन्यवाद।
Wise words. On this note, let's conclude a remarkable, memorable, and knowledgeable valedictory session of the AIU's Central Vice Chancellors Meet. Have a nice time. Jai Hind.
मैं यहाँ पे डॉक्टर आलोक मिश्रा जी को भी धन्यवाद देना चाहती हूँ हम लोग सबके तरफ से। एक तो वोट ऑफ थैंक्स के लिए, दूसरा माननीय मंत्री जी को इनवाइट करने के लिए। उनका इतना इंस्पायरिंग भाषण सुन के बहुत अच्छा लगा। प्रोग्राम का एंड जो है सबसे अच्छा रहा फिर ओवरऑल। थैंक यू सो मच। थैंक यू मैडम एंड
धन्यवाद सारंग जी, धन्यवाद
धन्यवाद
वेरी मच प्रेसिडेंट साहब। थैंक यू वेरी मच।
Thank you very much. Thanks to all.
थैंक यू, नमस्कार नमस्कार।
Thank you.
Thank you, madam.
Thank you.
Thank you, sir.
Thank you.
नमस्कार। थैंक यू।
Namaskar. Thank you, Vice Chancellor.
Thank you.
नमस्कार।
थैंक यू।
Thank you, sir.
Thank you.
Alok sir.